Good evening, everyone, and welcome to Assembly Committee on Commerce and Labor. Secretary, will you please take roll?
Assemblywoman Backus. Assemblyman Carter. Assemblywoman Duran. Here. Assemblywoman Hardy. Here. Assemblywoman Howdigi.
Here.
Assemblywoman Kasama. Here. Assemblywoman Monroe Moreno. Here. Assemblyman O'Neill. Here. Assemblywoman Torres. Here. Assemblyman Yeager. Here. Assemblyman Urick. Here. Chair Marzola.
And I am here. Please mark Assemblyman Carter absent excused. Today we will hear two bills, Assembly Bill 386 and Assembly Bill 437. We will be taking those out of order, and we will have a work session as well. We will do the work session first. Before we get started, I'd like to make a few housekeeping announcements. Please turn off your electronic devices. If you don't want to turn them off, please put them on silent, whether your computer or your cell phone. If you wish to testify, please sign in at the table by the door. If you have a business card, please leave one. If you have any handouts for the committee, please provide 20 copies to the committee secretary prior to your testimony. For those testifying online, please be sure to mute your microphone when you're not speaking to minimize any background noise. When testifying, please turn on the microphone and clearly state and spell your name for the record. I expect courtesy and respect in all our interactions in this committee. And with that, we will go to our work session. A work session is to take action on measures the committee has heard in previous meetings. It is not customary for the committee to take testimony or otherwise rehear the bills during any work session. However, I may invite a witness to come forward for clarification or questions during a consideration of a measure. With that, we will begin our work session with Assembly Bill 334. I will turn the meeting over to Policy Analyst Mrs. Thomas. You may begin when you're ready.
Thank you, Madam Chair. Assembly Bill 334 revises provisions relating to insurance for motor vehicles. It is sponsored by Assemblywoman Brown May, heard by the committee on March 24th. There are 5 proposed amendments by the sponsor. The first is to amend Section 1 of the bill to increase the time period in which an insurer must conduct an inspection for repair or further inspection of a motor vehicle relating to a claim by an insured or a claimant from 6 business days to 8 business days. Amend the bill to require that at the time of inspection or further inspection of a motor vehicle, an insurer must provide a copy of its estimate, which must at a minimum indicate the extent of known damage and manner of repair. The third proposed amendment is to amend subsection 4 of section 1 of the bill to include and furnish a copy of its estimate. Proposed Amendment 4 is to amend subsection 5 of section 1 of the bill to include claimant, and the fifth is to delete subsection 6 of section 1 of the bill and instead provide that a person who violates the provisions of the bill is subject to an administrative fine of $1,200 per violation.
Thank you. Members, are there any questions? I don't see any. I'll entertain, a motion to amend and do pass of Assembly Bill 334.
So moved.
I have a first from Vice Chair Howdigi. Is there a second? Oh. I have a second from Assemblywoman Monroe Moreno. Is there any discussion on the motion? Assemblyman O'Neill?
Chair, I'm going to be a yes to get it out of the committee today because I know we're coming up on a deadline. But I will say that I think that the bill still needs some work done, and I will be a no on the floor if there aren't some amendments made to this bill. So I will be yes with reservation, please.
Thank you. Thank you. All those in favor say aye.
Aye.
All those opposed say nay. Can you lift up your hands, please? We have a nay from Assemblywoman Hardy, a nay from Assemblywoman Kasama, and a nay from Assemblyman Urick. Motion carries. I will assign that statement to Assemblywoman Brown May. Next is Assembly Bill, Just so everyone knows, I am polling Assembly Bill 415. It would not be work session today. Assembly Bill 443 is our next bill.
Assembly Bill 443 expands the institutions which certain recipients of the Governor Gwynn Millennium Scholarship are authorized to attend. It is sponsored by the Committee on Commerce and Labor, heard on April 7th, and there are no proposed amendments.
Thank you. Members, are there any questions? I don't see any. I'll entertain a motion to do pass on Assembly Bill 443. I have a first from Assemblywoman Monroe Moreno. Is there a second? I have a second from Assemblyman Urick. Is there any discussion on the motion? I don't see any. All those in favor say aye.
Aye.
All those opposed say nay. I will assign that statement to Vice Chair Howdigy. That will conclude our work session for today. 1 minute recess.
The committee will now come back to order. I am now going to open the hearing on Assembly Bill 437. Chair Marzola, when you're ready, please begin.
Thank you, Madam Vice Chair and members of the committee. I'm Assemblywoman Elaine Marzola, representing the beautiful Assembly District 21. With me today is Deanna Levis, Secretary and Treasurer from the United Food and Commercial Workers, Local 711. She should be in Las Vegas. There she is. I'm here to I'm here to present Assembly Bill 437, which limits the amount a provider of health care may charge for filling out certain forms associated with certain leaves of absence. Passed in 1993, the Family and Medical Leave Act, also known as FMLA, is a federal law that entitles eligible employees of covered employers to take unpaid job-protected leave for specified family and medical reasons. FMLA did not cap the fee a doctor may charge a worker to complete the form employers need. The burden of paying the fees fall upon the employer, upon the employee, as the federal law does not require employers or insurance companies to pay the doctor's fees. Workers must have providers process forms to receive their FMLA leave. Across the Las Vegas Valley, provider offices are charging over $100 to process an FMLA or leave of absence certification. This far exceeds the national standard of $25 to $30. The unregulated cost creates a financial burden for working families in Nevada, who are also taking leave from work to address medical needs for themselves or loved ones. AB 37 is a very short bill. As you can see, Section 1 prohibits a provider from charging more than $10 to complete a form required for an employer. With your indulgence, Madam Vice Chair, I will now turn it over to Deanna Levis. She's in Las Vegas.
Thank you, Vice Chair Hadagi, and members of the Assembly Commerce and Labor Committee. My name is Deanna Levis, D-E-A-N-N-A-L-E-I-V-A-S, and I'm Secretary Treasurer of UFCW Local 711. I'm here to testify in support of AB 437, which would place a $10 cap on FMLA certification fees. UFCW Local 711 represents over 7,000 workers throughout Nevada. Our members work in grocery stores, retail drug establishments, and cannabis cultivation facilities and dispensaries. UFCW Local 711 members were designated as essential workers during the pandemic and kept our communities fed throughout our state. This issue is very important to all working families in the state of Nevada because at some point everyone is going to need to take time away from work to care for themselves or a family member. The Family Medical Leave Act is the nation's first and only federal law designed to help people meet a dual demand of work and family. The FMLA guarantees eligible employees up to 12 weeks of unpaid leave each year to care for a newborn, a newly adopted child, or a seriously ill family member, or to recover from one of their own serious health conditions, including pregnancy. America's workers have used the FMLA for more than 315 million times to take time off when they need it the most, without having to worry about losing their job or their health insurance. And an overwhelming majority of work sites report no difficulty complying with FMLA. Labor and community leaders have all seen the signs and heard the stories of the continuing rise in costs of FMLA certification fees in our state. We have heard from members that some of those costs are upwards of $100. Working families should not have to continue to cover this cost while taking unpaid time off for family or medical leave. After all, they already paid to see their health care provider and should not have to pay again for a form. The worker will be stepping out of the workforce under FMLA, and forcing them to bear this additional cost is wrong. Nevada legislatures must act to provide consistency and lessen the financial burden for working families. I urge you to do so by supporting AB 437 today. Thank you for your attention to this issue and for the opportunity to speak with you today.
We will stand for question, Vice Chair.
Thank you, Chair Marzola. Members, I'm going to go to Assemblymember Kasama first.
Thank you, Chair. Can you just give me some context? I mean, I don't know the form. Is it a one-pager, half a page? Is it 10 pages? What's involved with filling out the form?
Madam Vice Chair, members of the committee, Jessica Ferrato here on behalf of UFCW, just to help answer some questions. Great question, Assemblywoman. Most of them are two-page forms. They do vary a bit depending on the employer, but we can get you some examples so that you can have a few examples of what they look like.
Well, that's probably good, just like a two-page form. And is there any consideration for, I don't know, the $10 charge having a CPI index to it? I mean, if we're here 20 years from now and $10 doesn't cover the form, just a thought. I don't know if you thought about that.
Jessica Ferrato for the record on behalf of USW through you, Vice Chair, to Assemblywoman Kasama. We haven't thought about that yet. Most states that do this have sort of a standard rate. I think that we were looking at something that was just something that would be more affordable for working families. I think we haven't considered that at that point, but we can continue discussions.
Thank you. Just curious. Thank you.
Members, any other questions? Okay, I'm going to go to Assemblyman O'Neill.
Thank you, Vice Chair, to allow me to ask questions on this very simple bill, although maybe short. I do have Chair, in your testimony, you said that the average across the country, so you already really looked into this, and I appreciate that, is I think you said around $25?
That's correct. The national standard is around $25 to $30.
And I guess it goes along with the last question. Why aren't you going with 25 then? That would take care of probably inflation for some time. Why did you settle on 10, if you wouldn't mind? Thank you.
For the record, Jessica Ferrato here on behalf of UFCW through you, Vice Chair, to the Assemblyman.
No direct.
Thanks. That's a range, Assemblyman, so the $25 to $35 is just sort of an average. There are some that are lower, there's some that are higher. I think we started on the low end because we wanted it to be affordable for workers in the state of Nevada, but are open to suggestions. Thank you.
And may I just follow? Do you know, I know when I've been to the doctors, when I got operated and needed a return to work form to say that I was up to par again, it was just part of my natural doctor's appointment, and there was no billing, and insurance picks up that visit anyways. I guess I'm confused still a little bit that how many, that the really providers charge up to $100 for this form, or is it part of what they're charging for the medical examination is the $100, and the form is just part thereof?
Assemblywoman Elaine Marzullo for the record. Thank you for the question, Assemblyman. So I have a constituent who needed FMLA forms filled out from her own treating physician, and the doctor would not do it unless she paid $120 cash. That's correct.
Thank you.
Thank you. I'm going to go to Assemblywoman Duran.
Thank you, and thank you for this bill. I was just wondering, and do you know, because I know to get recertified for FMLA, the companies can have you do that and keep making you go back to the doctor to get those forms filled out. Is that correct?
Assemblywoman Elaine Marzullo for the record. That is correct. It all depends, but usually the certification is once a year.
And I know, as working in the industry as well, I know some of the places will have you sometimes recertify up to 6 months after for that. So I don't know if you know have any. I know it's certain. Some places go once a year, but some places make you go more than once. Correct? Or do we know how many times they have that?
Jessica Ferrato on behalf of USCW. Thank you, Assemblywoman. My knowledge was once a year, but we can get that information because I think it does depend on the amount of leave you're taking and your employer's internal policies. So we'll find out a little more information and get you something. Thank you.
Assemblyman York? Perfect. Speaker.
Thank you so much, Madam Chair. Thankfully, I've never had to use FMLA, so I don't know a lot about how it works, but I just had a couple of questions that I hope will be quick. I'm assuming that the federal law requires the form to be filled out, and that's why it's being done.
Elaine Marzullo for the record. That is correct, Mr. Speaker.
Okay, thank you. And then Chair or Vice Chair, if I could, so which doctor is actually filling out the form? If I'm taking family leave to take care of a family member, is it the family member's doctor who fills out the form, or if if you have a newborn at home? I mean, I'm just trying to figure out is it going to be my doctor or is it somebody else's doctor who fills the form out?
Jessica Ferrato for the record. Typically, if you're taking care of a family member, it would be their doctor, and if it's for yourself, your doctor.
And then Vice Chair, if I could, I promise I'll make it quick. So I just wanted to clarify this $10 cap that's in here, that's not like the maximum you'd pay for the actual doctor's visit. You're just talking about the filling out of the form. So whatever your relationship is with your physician or a family member relationship, they're going to have all that stuff come into play with co-pays, insurance, if they don't have insurance, out-of-pocket costs. And I'm seeing nodding of heads, so maybe we don't need a response. And then I guess just, Vice Chair, if I could, I mean, I honestly like the bill, but I sort of feel like it should be no cost, to be quite honest. I mean, I don't know, $10 in today's world isn't much, but I understand we have to give some sort of compensation, but I would actually be in favor of just saying they can't charge anything.
Committee members, any other questions? Okay. Well, I just want to take a moment of privilege to say thank you for bringing this bill, because I know that my doctor that I go to for my annual checkups. He has these notices posted in every single one of his waiting rooms, and he charges at minimum $100 as well. So thank you. With that, we will go to testimony in support. If anyone here in Carson City wishes to testify in support of this bill, please approach the table. We will then go to testimony in support in Las Vegas and then on the phone.
Good evening, Madam Chair and members of the committee. My name is Marlene Lockhart, representing SEIU 1107. The current practice of some healthcare providers charging excessive fees for filling out FMLA forms creates an unfair and unnecessary barrier for employees asking to exercise their rights under this important federal law. These fees can quickly add up, placing an undue burden on employees who are already dealing with the physical, emotional, and financial challenges of a medical leave. This proposed bill to limit the amount a provider of health care may charge for filling out FMLA forms is a much-needed step towards ensuring that employees are not deterred from taking necessary medical leave due to financial constraints. By setting reasonable and standardized fees for completing the forms, this bill will help protect the rights of employees to access the benefits they are entitled to under FMLA. We urge your support of this bill. Thank you.
Thank you for your testimony. Please proceed.
Thank you, Vice Chair. For the record, my name is Susie Martinez, and I am the Executive Secretary Treasurer for the Nevada State AFL-CIO. And on behalf of over 150,000 members and 120 unions, we are in full support of Assembly Bill 437. Thank you very much.
Thank you for your testimony. Please proceed.
Paul Catha, CATHA, representing the Culinary Workers Union Local 226. I can't do it better than Marlene, so I won't. We support Assembly Bill 437. Thank you.
Thank you. Thank you for your testimony.
Kent Irvin, Nevada Faculty Alliance. Being able to use FMLA is very important for our members to keep their families together and come back to work. And we believe that the fees for the certification part on top of regular medical evaluation should be reasonable. Thank you.
Thank you. Is there anyone else in Carson City wishing to testify in support? Okay, we will move to Las Vegas. Please state your name for the record and spell it, and when you're ready, please proceed.
Good evening, Vice Chair Jauregui and members of the Committee on Commerce and Labor. My name is Juanita Figueroa, Juanita Figueroa, and I live in Las Vegas, Nevada. I have worked for Smith's grocery store for over 20 years, and I have been a member of the UFCW Local 711 for just as long. I come from a large family. Growing up, I was one of 8 siblings, and I was my mom's right hand in the family, and she taught me to work hard and every day. Now, as a single mom myself, I was able to see my 25-year-old daughter get married. When it comes to high fees for FMLA forms, make it harder for working men and women in Nevada at a time when they are already financially and emotionally stretched with either a new baby, a family member being deployed, or a serious illness. For me, it was a serious illness. 8 years ago, I was diagnosed with cancer, and at a time, I was a single mom trying to pay my bills and raise my daughter. I had insurance at the time because the union collectively bargains that for us, but things were tight. And I'm not sure if I will have been able to cover that cost of $100 form on top of everything else. I can't imagine all the other men and women in Nevada without insurance or a union that must pay these fees out of pocket just to keep their jobs. Please support AB 437 today and place a $10 cap on this fee and ease some of the hardships men and women face in our state when taking FMLA leave. Thank you for listening to me today.
Thank you for your testimony and for being here in an evening meeting. Is there anyone else in Las Vegas wishing to testify in support? Okay, seeing none, BPS, can we please check the telephone line for testimony in support of Assembly Bill 437?
Callers, if you'd like to testify in support of Assembly Bill 437, please press star 9 now to take your place in the queue. Caller, with the last 3 digits 390, you are unmuted and may begin. Caller, with the last 3 digits 390, you're unmuted on our end. Is your phone muted?
Can you hear me?
Yes, we can hear you. Please state your name and spell it for the record and then proceed with your testimony.
Thank you. Good evening, Chair Marzola and members of the committee. For the record, my name is Wendy Colborn on behalf of the Northern Nevada Building Trades Council. We support this bill and urge the committee to support it also. For a lot of working people in Nevada, the cost of filling out these forms is an obstacle to workers trying to care for their families at critical and sensitive moments in their lives. No one should have to carry any extra burden at moments like these. Thank you.
Thank you for your testimony. BPS, next caller, please.
Thank you, Chair Marzola and members of the committee. I'll keep it today simple today. My name is Edward Goodrich, Goodrich. I represent the International Alliance of Theatrical Stage Employees, Local 363 in Reno. We are in full support of AB 437 and any other legislation that restrains undue and outrageous financial burdens on workers for legally required standard forms. I thank the committee for its time.
Thank you for your testimony. BPS, next caller.
Good evening, Chairwoman Marzola and members of the committee. For the record, my name is Robert Sumlin, Robert Sumlin, and I am with the International Association of Machinists and Aerospace Workers, Local Lodge SC 711, Las Vegas, Nevada. I support this bill because workers shouldn't have to pay a burdensome amount of money out of their own pockets to receive information required by their employers. We strongly urge the committee to support Assembly Bill 437. Thank you.
Thank you for your testimony. BPS, next caller.
Good evening, Chairwoman Marzola, and members of the committee. My name is Larry Wilson, and I'm with the United Auto Workers, and we stand in strong support of this bill because it's a burden for our members to have to pay in order to have family sick leave. Thank you.
Thank you for your testimony. BPS, next caller.
Caller, with the last 3 digits 418, please press star 6 to unmute yourself.
Good evening, Chairwoman Marzola and members of the committee. For the record, my name is Beverly Williams, Beverly Williams, Beverly Williams. I am the Secretary Treasurer for the Southern Nevada Central Labor Council. I strongly urge the committee to support Assembly Bill 437. It is an undue burden on our members as they have to pay for their doctor bill and then on top of that to pay extra money to have their forms filled out. Thank you very much.
Thank you for your testimony. BPS, next caller.
Thank you, Chair. For the record, my name is Shelby Swartz, SHELBIE SWARTZ, on behalf of Battleborn Progress, and we are in support of AB 437 because it ensures that folks have access to the important leave benefits like FMLA that they are entitled to. These benefits provide job protection and income support for individuals who need time off work due to serious medical conditions, injury, or to care for a family member. If the cost of obtaining these forms is prohibitively high, it can create a barrier to accessing these benefits, particularly for individuals who are already facing financial hardship due to their medical condition or caregiving responsibilities. Also, it's important to note that many individuals who require these forms may already be facing significant medical expenses, including costs for treatment, medications, and other healthcare services. We urge your support. Thank you.
Thank you for your testimony. BPS, next caller.
Good evening, Chairwoman and members of the committee. For the record, my name is Liz Sorensen. That's L-I-Z, first name, last name, S-O-R-E-N-S-O-N. I am the president of the Nevada State AFL-CIO, and for all the reasons stated by the previous caller, I too am in strong support of AB 437. I urge this committee to support the bill as well. Thank you so much for your time. Thank you.
And thank you for your testimony. BPS, next caller, please.
Callers, if you've recently joined and would like to testify in support of Assembly Bill 437, please press star 9 now to take your place in the queue. Chair, we have no more callers in support at this time.
Thank you, BPS. We are now going to go to testimony in opposition. Is there anyone in Carson City wishing to testify in opposition of Assembly Bill 437? Okay, seeing none, we are going to move to Las Vegas. Is there anyone in Las Vegas wishing to testify in opposition to Assembly Bill 437? Seeing none, BPS, can we please check the telephone line?
Callers, if you'd like to testify in opposition to Assembly Bill 437, please press star 9 now to take your place in the queue. Chair, we have no callers in opposition at this time.
Thank you. Is there anyone in Carson City wishing to testify in the neutral position? Is there anyone in Las Vegas wishing to testify in the neutral position? BPS, could we please check the telephone line for anyone wishing to testify in neutral?
If you'd like to testify in neutral for Assembly Bill 437, please press star 9 now to take your place in the queue. Chair, we have no callers in neutral at this time.
Thank you so much. I will now close the hearing on Assembly Bill 437. Committee, we are going into a 1-minute recess. The committee will now come back to order. Before I open the hearing on Assembly Bill 386, I just want to notify everyone that, one, thank you for taking the time tonight to come and be with us, whether here, by phone, or in Las Vegas. Today, for testimony in support, testimony in opposition, and testimony in neutral, I will be taking 30 minutes for each.
So 30 minutes for support, which will be 10 minutes here, 10 minutes in Las Vegas, and 10 minutes on the phone. I will do the same for opposition, and I will do the same for neutral. And with that, I will open the hearing on Assembly Bill 386, which revises provisions relating to midwives. Assemblywoman Monroe Moreno, you may begin when you're ready. One minute recess. The committee will now come back to order. Assemblywoman Monroe Moreno, you may begin when you're ready.
Thank you, Madam Chair, and thank you, members of the committee. For the record, I'm Assemblywoman Danielle Monroe Moreno, and I represent Assembly District 1. Tonight, I'm here to present Assembly Bill 386, which revises provisions relating to midwives. I'm joined here today at the table by Tiffany Hoffman and Amanda McDonald, both who are certified professional midwives here in Nevada. As a legislator, there have been a few subject matters that I have focused my work on in this building, that being updating the Nevada's grants management and acquisition process, issues dealing with juvenile justice, and issues dealing with behavioral health care and maternal and child health care. Tonight, we are here to discuss a maternal and child health care bill. During the 80th legislative session, I sponsored Assembly Bill 169, establishing the Maternal Mortality Review Committee, which required the committee to review each incident of maternal mortality or severe maternal morbidity in the state. Last legislative session, I sponsored Assembly Bill 287. 287 revised certain terminology and provided for the licensing and regulations for freestanding birthing centers, which passed this legislative body with bipartisan support and became effective upon passage. And as you may recall, last session I also sponsored a midwife bill, Assembly Bill 387. At the end of session, it passed this body with bipartisan support, but the bill ultimately did not pass out of the Senate on sign and die by one vote. This session, Assembly Bill 386 picks up where Les Sessions' bill ended. Now let's be clear, I am not a midwife or an attorney, nor do I play either on TV. But I am a mom and a grandma. I have my own birthing stories and that of my children. However, we're not here tonight to discuss my stories. However, I did share parts of my story during the 2019 MMRC bill presentation, which prompted many constituents to reach out to me during that interim, sharing their stories, some which were heartbreaking. I was asked to work on legislation that provides birthing families with safe, healthy birthing options. And I say birthing families not necessarily birthing parents, because what we have learned over the last few years, not every woman who carries a child is the parent of the child. My birth mother carried me. I have yet to meet her. She gave me up for adoption. You remember, in 2020, we were right in the midst of the COVID pandemic. Women were entering hospitals alone to give birth. They were searching for options that their families could be with them. At that time, looking for options of freestanding birthing centers and midwives, and asked me, was there a list in the state of Nevada for licensed midwifery? And I went searching for one, and I found that there was not, because Nevada does not provide a licensure for midwifery. So I went to work to find answers to the questions that I have been asked by my constituents. Healthy options, birthing options for birthing persons. And I found a few licensed midwives or certified midwives in our states that also wanted to provide a licensure to fill that question. So since 2020, Ms. Hoffman and Ms. McDonald and I have held several stakeholder meetings, some in person, some virtually. They held more than I was able to attend because my workload was a little high here at the legislature, and in the interim, when people think we don't do anything, that is so wrong. We do. But we have worked tirelessly during the past interim, seriously listening to the opposition on this piece of legislation. Just as a background, just to refresh your memory if you forgot from last session, midwifery has been in practice in the United States for hundreds of years. Midwives provide care through the perinatal, delivery, and postnatal states of childbearing to women who are healthy and experiencing a normal pregnancy. A midwife monitors the physical, psychological, and social well-being of the birthing parent throughout the childbearing cycle. When needed, a midwife identifies and refers the few women who need obstetrical care to the proper doctors, if needed. Now, I carry the MMRC bill because as a Black woman in America, well, let's just say this. Birthing outcomes in America are at, I would say, dismal in comparison to some third world countries, which is really sad because we're such a developed nation. But when it comes to Black and brown mamas, we're dying at higher rates at giving birth in America. So having options, healthy options, is something I never want to take away from women. So I was very happy when Tiffany and Amanda joined me on this mission. As I said, I'm not a midwife. I don't play one on TV. So I'm going to turn the presentation, with your permission, Madam Chair, over to the real midwives, and then come back and I'll walk you through the bill and close out for questions.
Yes, absolutely. You may begin when you're ready.
Good evening, Madam Chair and members of the committee, and thank you for this opportunity to come and speak with you this evening. My name is Tiffany Hoffman, and I'm here with my colleague, Amanda McDonald. We're certified professional midwives practicing in Reno, as well as licensed midwives in the state of California. We're here today to share our interest in licensure for certified professional midwives in the state of Nevada. Nevada has a proud history of reproductive choice. Writing this bill has been a focused effort to maintain and expand that choice, reduce harm, honor traditions, increase accessibility, and improve outcomes for all of the birthing people in Nevada. The questions we've asked in creating this bill both last session and this year were, how can we improve safety and satisfaction for consumers? What is the bottom line to improve outcomes according to the available research? How do we honor and respect the history of midwifery while advancing the profession? How do we protect choice for Nevada families? How do we best improve access to community birth for all Nevada families? How do we increase the number of underrepresented midwives to provide culturally and linguistically congruent care? How do we begin to bridge the divide between community and hospital providers that is so desperately needed? We have extensively reviewed research statements from major organizations invested in improving outcomes for childbearing people and babies internationally and in the U.S., listened to consumers of all types of midwifery services, listened to families that have experienced losses and bad outcomes, listened to every type of midwife, physicians, lobbyists, and legislators. Everyone interested in this topic is extremely passionate, and middle ground is really hard to find. Every attempt has been made to come to a center. We are 2 of 8 that currently vocally support licensure of midwives with AB 386. For clarity, we will be using the preferred term community birth to refer to any planned birth outside the hospital setting in homes and birth centers. And before we begin, we just want to let you know we'll be sharing some information that might be hard for some people to hear, so please take care of yourselves. The U.S. currently has a dire maternal health crisis. Our country fails to provide equitable, accessible, respectful, and safe and affordable care. In the CDC data released last month, maternal mortality is at its highest rate since 1975. More people die per capita from pregnancy and childbirth in the U.S. than any other high-income country in the world. And our healthcare system spectacularly fails communities struggling with the burden of structural inequities due to racism and other forms of disadvantage. Black women in Nevada are 5.5 times more likely to die from pregnancy-related causes. This is compounded by the fact that a large part of Nevada is a maternity care desert, and even in urban areas, many pregnant people are unable to obtain early prenatal care. This is an urgent need. There's an urgent need for a more equitable and cost-effective maternity care system with better outcomes and more options for birthing families. Recent research has highlighted the key role that community midwives and community birth settings play in this transition. The majority of research from other countries comparing planned home and birth center birth to hospital birth have found no difference in fetal and neonatal deaths, low APGAR scores, or NICU admissions. But applying this research to all states in the U.S. isn't truly accurate. Why, might you ask? Lack of integration across settings and consistency in legal recognition of credentialed midwives. Sorry, let me change.
Amanda McDonald for the record. You got it?
No.
All right.
Okay, there you go. Sorry, there we go.
Perfect. Although C-sections can be life-saving, they are currently vastly overused and carry short and long-term risks for birthing people and babies. ACOG's statement on reducing primary cesareans and CMQCC vaginal birth toolkit risks to birthing people and babies are high when cesarean rates are high. Nevada currently has the highest cesarean rate in the western United States, and that means that 1 of every 3 birthing people that enter the hospital will leave having had major surgery. This is where midwives come in.
So what is a certified professional? Sorry, Tiffany, for the record. So what is a certified professional midwife? A CPM is an autonomous primary perinatal care provider for pregnant people with essentially healthy pregnancies. We are distinctly different profession from nursing or medicine with a national certification. We provide comprehensive care in the preconception period as well as prenatally during labor and birth and the postpartum period. We provide well woman and well person care, including pap smears and STI testing. We are experts in the wellness model, person-centered, physiologic approach to pregnancy and birth. Our training and expertise are in attending birth in homes and freestanding birth centers. We are the only type of perinatal care provider required to have experience in the community setting for certification. So what are the benefits of CPM care? Our philosophy is vastly different than the traditional medical model of care. Rather than viewing pregnancy and birth as a pathological state or medical condition that needs to be managed in the same way as an illness would be, we consider birth to be a normal physiologic process best supported through a person-centered focus on wellness. Research shows that 97% of families who've had a community birth were satisfied with their care and experience. We provide longer prenatal visits and more postpartum visits, often in your home, along with clinical checks. Significant time is spent in relationship and trust building, providing support and education and answering questions. Very often we have met and gotten to know several members of your family. We have spent time in your home. We've listened to your deepest hopes and desires as well as your fears during our often hour-long visits, and we are invested. When labor starts, there's more freedom and autonomy than with birth in the hospital, with freedom of movement, eating and drinking without limitation, choice of any and all support people you want with you during your birth, help with non-medication comfort measures because you are the ultimate decision maker. We follow your lead. We honor the physiology of birth, and if needed, we discuss judicious use of interventions when indicated or requested with full consent. At home birth, midwives have the luxury of providing focused one-on-one care with just one laboring person. We spend hours with you in labor and several more hours with you, celebrating you and the work you've done, helping you bond with your baby while continuing to monitor you and your baby's well-being. Because we are able to offer a truly personalized one-on-one physiologic approach to perinatal care for essentially healthy pregnancies, we see a significant reduction in interventions during labor and birth. So what does the research show, particularly in well-integrated locations? In a recent Cochrane review, it is stated that increasingly better observational studies in different settings suggest that planned hospital birth for women at low risk of complications is not any safer than planned home birth assisted by an experienced midwife with collaborative medical backup. Hospital birth may, however, lead to more interventions and more iatrogenic complications. Two additional systematic reviews and a Washington State study on low-risk birthing people planning community births in high-income countries found that people giving birth at home were more likely to have a vaginal birth, no tearing or episiotomy, and exclusive breastfeeding at 6 weeks, and less likely to have a cesarean birth, an epidural, meds to speed labor, vacuum and forceps delivery, severe tearing, severe postpartum hemorrhage. And in Washington State, they reported a perinatal mortality rate comparable to nations with strong midwifery integration across all birth settings. Babies at home have similar rates of stillbirth and early newborn death, less likely to be born preterm, less likely to be low birth weight, and are significantly less likely to be admitted to NICUs. CPMs can also provide access to care in rural areas and those experiencing a perinatal care shortage. CPMs provide cost savings to families, the state, and insurance companies due to these lower intervention and cesarean birth rates.
Interest in community birth vastly exceeds use. In the Listening to Mothers California report...
Can you state your name for the record, please?
Sorry, Amanda McDonald. In the Listening to Mothers California report, 40% expressed interest in a birth center for their next birth, and 22% expressed interest in a home birth. Lack of access interferes with a childbearing person's right to choose. The choice of birth settings and provider are deeply personal choices that are informed by subjective assessments of benefits, risks, and weighing the two. From 2004 to 2019, community births rose 91%. Of those, it was home births rising 83%, and birth centers were risen 130%. In Nevada, 2021, the community birth rate was 2%, and that's up from 1.7% 3 years ago, and the current national rate is 1.4%. Some of the reasons for increased utilization would be inconsistent insurance coverage and high deductibles, a high level for self-pay, loss of rural hospital maternity units and provider shortages, COVID-19 pandemic, increased interest quite a bit, rising publicity about and fear of disrespectful and unsafe treatment, particularly for Black birthing people in the hospital setting. Desire to avoid interventions and cesarean. According to the ACOG Revitalized paper, only 1 in 20 birthing people actually experience a physiologic birth without major intervention in the hospital. Also, the desire for control of environment and choices, along with fear of the hospital and prior bad experiences. According to public information, national and state databases, there are currently 19 active CPMs plus 1 not in active practice in Nevada, and 10 active uncertified midwives plus roughly 9 not in active practice. It is harder to track the number of uncertified midwives in the state of Nevada because there is no database. So we are also using some info that we've heard from other uncertified midwives in meetings we've had with them. There are 5 CNMs practicing in the community setting. We've heard claims that up to 70 community midwives exist in Nevada. However, we have been unable to find data to support those numbers, which seem to be inflated. Between current CNMs and newly licensed CPMs, should this bill pass, about 80% of Nevada's midwife-attended community births could be attended by a licensed healthcare provider versus the currently 20%. That's a 300% increase. Nevada stands alone in the West as the only unlicensed state. This map shows current licensing trends in the U.S. So there are 37 states that license their CPMs, that's the green. 5 states have active CPM bills like Nevada, and they are light pink. 5 states are planning CPM legislation, they are the darker pink color, and only 3 states are legislatively inactive. There are national midwifery organizations working hard to achieve licensure for CPMs in all 50 states for the benefit of public and the midwifery profession itself.
Tiffany Hoffman. Why is licensure good for the public? Licensure is a mechanism by which the members of the midwifery profession are held accountable to the public for providing safe care that is consistent with the scope of practice defined by the profession and upheld by state law and subsequent regulatory guidelines. There's accountability. There's currently no recourse for families if a midwife is practicing outside their scope or otherwise practicing unsafely. This bill would provide official processes and paths for both the family and the state if warranted. It improves safety, legal access to life-saving medication for midwives, in addition to integration, collaboration, and other points that will be listed further. And there's transparency, mandatory reporting of practices and outcomes in a state database, and access through cost savings, less likely to experience people are less likely to experience the benefits of home birth in jurisdictions in which home birth settings and providers are less integrated into the healthcare system, as shown by research. Integration is important. We all share the goal of healthy outcomes for birthing people and babies, but lack of reliable integration across providers and settings in the U.S. contributes to inferior outcomes relative to our peer nations. So what would improve that? Integration improves that. Lancet study of midwifery and quality care on a global scale. Maternal and perinatal outcomes are better in jurisdictions where midwives are regulated and have the legislative authority to practice to their full scope across birth settings, including collaborating with or referring to other health professionals. So who is doing better than us? Washington State is one of the exceptions and makes the case for greater integration nationally. Legal recognition, the presence of a strong, well-established professional organization, Medicaid reimbursement, many in-network insurance options, and a relationship between midwifery providers and their perinatal quality collaborative are all contributors to the great outcomes in Washington State. We also know from studies in other countries that community birth can be as safe and for some variables safer than birth outside of the hospital in an integrated setting. In the U.S., we don't have an integrated system of seamless collaboration and transfer across all settings, and in many areas in Nevada, midwife-physician relationships are non-existent, strained, or even openly hostile. When talking with providers who review cases of catastrophic outcomes, one of the most common issues is complicated transfers. Unwillingness, inability, or unfamiliarity on the part of EMS and hospital providers, as well as midwives in working together, does not serve the best interest of families. We were so relieved to see an assembly bill establishing a perinatal quality collaborative. It's much needed in Nevada, and there's much room for improvement. In that bill's presentation, we saw that Nevada's March of Dimes report card score is a D-, and our integration score for midwifery in the U.S., in the state of Nevada, is 29 out of 100. To add to that, currently most community midwives in Nevada are unable to refer clients to a perinatologist or consistently refer them to hospital-based providers when they develop a condition that requires a different level of care. Many OB providers will not see clients that are not under their care for pregnancy, and many MDs will not see pregnant clients who require treatment for STIs, nausea, UTIs, or glucose monitoring supplies, all things that are very commonly needed in pregnancy, which affects timely access to needed care. Home to hospital transfers are often strained at best and contentious at worst. Lack of collaborative training has led to inefficient and ineffective transfers from home to hospital. 2 states whose perinatal care collaboratives have led the way in supporting midwives and working towards collaborative relationships and improved outcomes are California and Washington. The California CMQCC in late 2022 added to their toolkit to support vaginal birth and reduce primary cesareans an addition that outlines integrating midwives and community-based care more fully into the medical system. Representation of licensed midwives within the Washington State Perinatal Collaborative for more than 2 decades has fostered interdisciplinary collaboration, and that relationship has led to the Smooth Transitions Quality Improvement Program that works to create efficient, safe, and respectful hospital transfers from planned community births. Another benefit has been greater willingness of OBs and hospital-based nurse midwives to consult and collaborate with community midwives prenatally. The current bill to create a PQC in Nevada does not guarantee an opening for CPMs or a home birth provider. We hope that changes.
Amanda McDonald. The Midwifery Integration Scoring System, or the MIS integration score, was created by a multidisciplinary group of experts to determine whether integration of midwives into the healthcare system improved outcomes. A MIS score of 100 would indicate that a family in that state would have full access to high-quality maternity care in all settings. I'm not going to go over the whole charts with you for the sake of time. So there are 2 charts in your packet of information that goes over Nevada's numbers, along with the 3 states that have the highest numbers in the nation, which would be Washington, New Mexico, and Oregon.
Tiffany Hoffman. We're going to move on to access. Access does not meet demand currently. The National Partnership for Women states too often childbearing people and their families, especially those in communities of color, cannot access and benefit from the midwifery model of care in the community setting. Increasing access to this model of care is an urgent priority that will improve maternal care experiences and outcomes in the U.S. In 2020, only 3% of hospital births were paid out of pocket, but almost 70% of planned home births and 34% of birth center births had to be paid out of pocket. Medicaid pays for 42% of all births in the U.S. and 50% in Nevada. CPMs currently cannot bill Medicaid in Nevada. So how do we improve access? Non-restrictive practice, early prenatal care, culturally congruent providers, increased access to birth centers, Medicaid and private insurance coverage. A lack of insurance coverage for community birth providers creates insurmountable financial barriers for many who would otherwise choose to birth in the community setting. Despite the clear value of midwifery care, especially as a way to help improve consumer satisfaction and obtain better outcomes for birthing people and babies, there are significant limitations to the accessibility and availability of midwives. This bill is just the first step.
Amanda McDonald. You're going to see this chart, which talks about the density of CPMs in states. Some opponents to Nevada's CPM licensure claim that it's going to reduce the number of midwives in the state of Nevada. Data collected by the North American Registry of Midwives, which is our certifying body, would suggest that this is often not the case. It is like the saying, if you build it, they will come. CPMs are often hesitant to move to an unlicensed state due to concerns about access and legality. The exception is CPMs who may move to Nevada after having restrictions to their license in other states. Those midwives are under no obligation to disclose this information to clients, and it is currently happening in our state right now.
Tiffany Hoffman. Cost savings is another large piece of the picture. Childbirth is the #1 reason for hospitalization in the U.S., and as mentioned, 50% of births in Nevada are paid for by Medicaid. As demonstrated in a Washington State independently conducted cost-benefit analysis commissioned by the Washington State Legislature, both excellent outcomes and significant cost savings were conferred by licensed midwifery care. The total savings to Washington Medicaid were approximately $1.6 million per year when facility fees and reductions in costly medical procedures were factored in. This is largely based on the greatly reduced cesarean rates between home and hospital birth settings achieved with CPMs. On a national scale, on average, CPMs cost the state less than $3,374 less than a low-risk hospital birth, and it has been projected that the U.S. could attain a savings of $321 million annually with a shift of just 1% of births from the hospital to the home setting, and an additional annual savings of $189 million with a shift of 1% of births from hospital to birth center, which is $500 million a year in savings. So what has been shown to improve home birth outcomes. Collaboration, integration, and autonomous practice are heavily supported by research. The reason that the U.S. home birth outcomes cannot directly be compared to the improved outcomes of home birth in other countries and in a few states is due to the lack of integration of CPMs, lack of collaboration between perinatal care providers, and the inability of CPMs to practice to their full scope. According to the Mapping Integration of Midwives Across the U.S. study in 2018, outcomes are best globally when midwives are regulated and practice to their full scope. Studies show that interprofessional teamwork is essential to the provision of high-quality maternity care. U.S. midwives with nationally recognized credentials provide expert care for birthing people and are educated to identify when a birthing person or baby needs higher levels of more specialized care than midwives can provide. Outcomes are best when midwives are regulated and practice autonomously to their full scope.
Amanda MacDonald. Collaboration is the active participation between autonomous individuals. Research shows that when professionals collaborate on decision-making and when coordination of care is seamless, fewer intrapartum, neonatal, and maternal deaths occur during critical obstetric events. In the committee hearing for AB 179, that happened, I think, last month, Dr. Irie, a perinatologist practicing in Reno and Las Vegas at the High Risk Pregnancy Center, said when people work together, we know as we work as a team, we all do better. Perinatal care has a wide range of providers, OBs, midwives, neonatologists, nursing staff. He went on to share that a collaborative approach, including all providers, increases communication, which we all want. However, in Northern Nevada, CPMs are unable to refer clients directly to either of the two perinatology practices, including High Risk Pregnancy Center. Previous poor outcomes from some midwives have caused these practices to refuse direct patient referrals from CPMs. Perinatologists cite liability concerns, lack of licensure, lack of educational standards, lack of accountability, and lack of physician oversight. We are not viewed as autonomous providers, and we are not offered the option to collaborate with these specialists. The next closest perinatology practice is over 2 hours away. This lack of timely, responsible, and safe referral options does not serve pregnant people, their babies, or their families. It only serves to harm. Another vital reason for collaboration is that when patients perceive interprofessional conflict, the culture of safety is diminished, and the potential for the patient to experience trauma following the birth is increased.
So how does AB 386 help Nevada? There's substantive research that shows outcomes are best globally where midwives are regulated and practice to their full scope. The goal of AB 386 is to improve outcomes, provide accountability, improve accessibility, all while providing CPMs the ability to practice autonomously. AB 386 would require direct on-site supervision of students and midwifery assistants. It would require basic training for midwife assistants. It requires anti-bias and anti-racism training for license renewal. NARM now requires that anti-racism training at each renewal, but we want to make sure it always remains a requirement for Nevada CPMs. It allows for the opportunity for CPMs to accept Medicaid. It provides legal access to medications. It requires statewide reporting. It establishes a transfer and collaboration work group to improve seamless transport, creates access to licensed CPMs.
And I just want to remind everyone to please state your name for the record before you start speaking.
Amanda MacDonald. Speaking about licensed CPMs, access to licensed midwives has been shown to improve safety. Numbers from birth certificate data in Oregon from 2012 to 2020. Oregon tracks birth statistics differently from other states, so they can provide information that other states in the U.S. currently cannot. Oregon offers a legal option for traditional midwives, which means they are unlicensed, uncertified to practice. It is important to note that this data on the graph cannot tell us the reason for the differences in rates between licensed midwives and traditional midwives, only that it exists. There are several possibilities. This research suggests that there is more to safety than location of birth alone. It's Madam MacDonald again. MIS scores, which we talked about earlier, also correlated with the density of midwives for access to care across settings. NARM does a jobs analysis every 6 to 8 years, and this graph is based on responses from CPMs themselves. When asked about the effects of licensure, most respondents believe that licensure had a positive effect on their state, with 71% agreeing that the benefits of licensure outweigh the drawbacks. 64% report that the number of midwives in their state has increased. There has been concern among Nevada's midwives who oppose licensure that the number of midwives will decrease in our state, and the research from our own accrediting body would not support this idea.
Tiffany Hoffman. Sorry. Any questions?
Madam Chair, before we go to questions, would you like me to walk through the bill?
Please.
Thank you. Assemblywoman Danielle Monroe Moreno for the record. Sections 2 through 32 of the bill generally provides for the licensure and regulations of licensed certified professional midwives by the Division of Public and Behavioral Health of the Department of Health and Human Services, and the regulations of licensed certified professional midwives by the Division and the Board of Licensed Certified Professional Midwives created by Section 17 of the bill. Section 2 through 14 defines board certified nurse midwife, certified professional midwife, birth assistant, certified professional midwife, student midwife, co-managed consultant, licensed certified professional midwife, medical facility, practice of certified professional midwifery, and refer. Section 15 exempts other providers of health care from the requirements governing the regulations of licensed certified professional midwives. It also does not prohibit gratuitous services of a person in an emergency or care by friends or members of the family. Section 17 through 19 creates the Board of Licensed Certified Professional Midwives, which is comprised of 9 members who are appointed by the administrator of the division and prescribe the duties and operation of the board. In addition, the board must adopt regulations governing midwifery, which includes licensure qualifications, investigations of misconduct and discipline, management of a client who is at a moderate or high risk of an adverse outcome, and certain other aspects of that practice of midwifery. Section 20 provides the requirements of the issuance of a license as a licensed certified professional midwife. Section 21 authorizes a licensed certified professional midwife to use a certified professional midwife birth assistant to perform certain simple routine tasks and prescribes the training for a birth assistant. Section 23 prescribes the authorized activities of a certified professional student midwife and requirements governing the supervision of a student midwife by a preceptor. Section 24 of the bill requires a licensed certified professional midwife to obtain informed consent of each client before providing service. A midwife must provide a community birth disclosure to all clients. Currently, only certain licensed practitioners who are registered with the State Board of Pharmacy may prescribe drugs and devices. Section 25, 40, 41, and 74 of the bill authorizes a licensed certified professional midwife to order, possess, and administer certain drugs, devices, chemicals, and solutions, and order certain devices and vaccines for a client. Similarly, Section 21, 23, and 79 authorizes a certified professional midwife, birth assistant, or certified professional midwife, student midwife, under the direction, supervision of a licensed certified professional midwife to administer certain drugs, devices, chemical solutions. Additionally, a student midwife may administer or implant a contraceptive device under the supervision of a preceptor who holds an appropriate special endorsement. Sections 26, 40, and 78 authorize a licensed certified professional midwife to apply to the board for a special endorsement for his or her license to order, dispense, and implant contraceptive devices or possesses, administer, prescribe, or possess certain dangerous drugs. Section 27 of the bill imposes specific requirements concerning the management of a client who is at a moderate or high risk of an adverse outcome, and Section 105 reverses some of those requirements on the effective date of the regulation adopted by the board. Section 27 also exempts 1, a licensed certified professional midwife from liability resulting from the informed refusal to consent of such a client to consultation, co-management with a referral to another healthcare provider, transfer to a medical facility, or the inability of such a midwife to arrange for such consultation or carry out such co-management referral or transfer. And 2, other healthcare providers for liability for the actions or omissions of such a midwife. Section 28 requires a licensed certified professional midwife to annually report certain information concerning his or her practice to the division when he or she renews his or her license. Section 30 of the bill requires the division to maintain records of proceedings relating to licensing, disciplinary actions, and investigations, and declares certain records must be confidential and other records to be available to the public. Section 31 prohibits a person who does not hold a license from representing that he or she is a license to engage in the practice of certified professional midwifery. However, a person who is licensed in another district, state, or territory of the United States may represent that he or she holds such a license. Further, a certified professional midwife student is prohibited from engaging in midwifery in circumstances other than those authorized by this bill or representing that he or she is qualified to engage in the practice of certified professional midwifery without supervision. Section 32 of the bill authorizes the division of the Attorney General to seek an injunction against any person violating the provisions related to the licensure and regulations of licensed certified professional midwives and student midwives. Section 37 requires a licensed certified professional midwife to report misconduct by a person licensed or certified by the State Board of Nursing to the executive director of the board. Section 48 and 49 of the bill provide that a licensed certified professional midwife is not liable for civil damages resulting from providing emergency care or gratuitous care to an injured person under certain circumstances. Section 65 requires Medicaid to cover the services of the licensed certified professional midwife and provide reimbursement for such services at comparable rates to other healthcare providers for such services. Section 70 and 71 requires a licensed certified professional midwife who attends a birth that occurs outside of a hospital that is not also attended by a physician or advanced practice nurse to prepare a birth certificate and provides that a person who provides such false information of a birth certificate may be fined. Section 76 clarifies that a licensed certified professional midwife is included in the definition of provider for health care, and therefore including him or her requirements for billing standards for advertisements and criminal penalties for acquiring certain debts. Section 107 of the bill creates the Collaborative and Transfer Guidelines Work Group to make recommendations to the board for the regulations governing transfer of such clients. Madam Chair, there are proposed amendments, and you should have that amendment up on Nellis, but I will walk you through the amendments if you like.
If you can, walk us through the amendment.
Perfect. The amendment adds 2 co-sponsors, Assemblywoman Summers Armstrong and Assemblywoman Thomas. In Section 17.2E, it changes voting member of a social worker to a non-voting member. It deletes Section 20.1 and replaces that section with completion of an education program that is consistent with the United States Educational Accreditation Standards and the U.S. Midwifery Education Regulations and Association Statement on Licensure of Certified Professional Midwives. In Section 26.6, an application for the issuance of the renewal of a special endorsement has been changed from 1,000 to 500. In Section 81.5, It clarifies the terms, applies solely to licensed certified professional midwives, not midwives as defined by NRS 442-003. It deletes Section 105 in its entirety. And that is the amendment as a whole. I've learned a lot in this process, working with DHHS, who could not be here tonight, but are at a good place with the policy and are neutral on the policy itself. We are working with NJA. There's a provision in the bill for liability insurance. And we have heard time and time again before this body that doctors are having a hard time getting malpractice and liability insurance. And there's absolutely no way midwives with their scope of care and the small risk pool that they have could afford the liability insurance that is required by our medical professionals. So NJA and I are working with what that amount should be, but it needs to be something that's commensurate with the job that they actually do, and it would be required for those who receive the license. I truly believe in this 4-year process that we've gone through on this. Licensing certified midwives is crucial for ensuring that birthing persons and their babies receive safe, high-quality care during childbirth. Certified professional midwives undergo rigorous education and are held to a standard of professional accountability. By requiring uncertified midwives to disclose their status is just transparency. We can help to ensure that birthing persons are fully informed about the care options that they're choosing. The bill is not against uncertified midwives. The bill is simply for those midwives who choose to be certified and held at a higher accountability, asking for that licensure. A licensing option will provide a clear framework for the regulations and to ensure that these certified midwives that choose to be licensed are held to a standard of practice and accountability to help improve the overall quality of care provided by midwives and help promote public confidence in the midwifery as a profession. You will hear from some of the opposition when they come up that no one wanted to join me on this bill. If you were here this last legislative session, it was an interesting process. I spent my career in law enforcement. I never had an inmate put a hit on me. I never had an inmate threaten my life. And I work with some of the worst that the community has to offer. But last legislative session, my husband called me while I was here and asked me what the H is going on. And I said, "What do you mean?" He said, "The police are at the door." And I said, "Okay, what's going on?" He said, "No, what's going on in Carson City? They're here because there's been a hit put on you." And I said, "Yeah, I know. It's a midwife bill. I never in my life would have thought someone who brings life into the world would want to take mine out." It wasn't just threats to me, it was threats to the ladies that are sitting here with me. So this legislative session, I intentionally did not ask anyone to join me in sponsoring this bill because no one needs to take on that responsibility. This is a bill that I chose to bring. 2 legislators have asked, even knowing they were here last session and they knew the risk. I'm happy to report we haven't had any of that this session, but this bill did that. We have had conversations with educational institutions about bringing the training that we were asking for in this bill to Nevada. And what we've heard time and time again, conversations with UNLV, with UNR, and specifically with UNR Cooperative Education, because they are in our rural communities. We'd like to do the training, but there's no licensure. Why have the expense of building a program, but there's no licensure for people to enroll in? So we're doing the work. You'll hear from some of the supporters they're waiting for this bill to pass to bring the training to Nevada. And with that, Madam Chair, we'll stand for questions.
Thank you, Assemblywoman, and thank you for your presentation. Committee members, are there any questions? Assemblyman O'Neill.
Thank you, Chair, for the time. I've got to say this bill's a little longer than that last simple bill that we had. And with that, I just need some clarification, if you don't mind, because we're talking about, if I get it correctly, licensed, and that there are unlicensed or non-licensed midwives operating in Nevada. In the bill, what protections are there for those that want to, the traditional non-licensed midwives? Is there any protection that they can keep practicing, or will this force them over? And I apologize for not having memorized the bill, but if you could help me, I'd appreciate it.
Danielle Monroe Moreno for the record, and that's okay. I've had a few years with this bill, so. When I initially decided to run this bill in the last legislative session, I made a promise to our community midwives, the traditional midwives, that I would not ask for a mandate for every midwife in the state to be licensed. There are a group of people that don't agree with that. But as I said, women have been having babies since the beginning of time. And when you're due to have your baby, that baby's going to come. And if you're lucky, you have someone there to help you through that birthing process. And long before there were OBGYNs, there were midwives, right? I did not want to take that away because that is a profession. However, in the state of Nevada, there's a mom that came to me that thought she hired a person, a midwife, who was licensed by the state. And she gave birth and lost her baby. And then sought out a remedy and found that the midwife that she hired was not licensed. One, because the state of Nevada does not have a license in the state. I don't know if that midwife was a certified midwife or not, but I believe that's still in litigation. That case is still in litigation. I believe as women, we have a choice in how we bring our babies into the world. I brought my children into the world in a hospital, but my oldest daughter, she did not. She's my flower child. She decided to use a midwife and gonna have a baby in a pool in her living room, and I thought she was nuts. And that was my very first session. When she went into labor, speaker told me, look, families come first. You gotta go. And I drove over the hill to be with her. She had her midwife, there was a student midwife, there was a nurse who was in training to be a midwife, her best friend, a photographer, and me. All there just for her. And it was an amazing experience that, looking back on, I wish I would have had. That little session baby came out with spirit fingers. The midwife did her weight, took all of her birthing charts, but she was licensed, certified professional midwife in the state of California who had transfer authority. She had my daughter enroll at the hospital, so if something were to happen, she could transfer her over. When she went into labor, they informed the hospital, but there was nothing bad that happened. It was an amazing thing that she went through. I don't want to take options away for birthing families at all. So that's why this is simply for those who choose to be licensed.
If I may, but is that stated in the bill any place, that this is purely optional for those that care to, so the non-licensed can keep doing theirs? I think that was one of the big issues we had last session, as I recall.
Yes, it is. And legal could probably direct us exactly to where it is. And I know he sent me a letter early. Danielle Monroe Moreno for the record. I'm sorry.
Thank you, Madam Chair. Sam Kwas, Committee Counsel. So that specific, it's not explicit in the bill that you don't have to get this license. However, the provisions of the bill do not prohibit anyone from acting as a midwife unless they get this license. It's clear from the provisions of the bill as drafted that the provisions of the bill set forth the process by which a person may obtain this license, but there's nothing that prohibits a person from acting as a midwife without this license.
Good.
Thank you, Chair, for the time. Thank you.
Committee members, any additional questions? Assemblywoman Backus.
Thank you so much, Madam Chair, and thank you, Assemblywoman Monroe Moreno and your guests for your presentations. Hearing your story about your daughter made me think of my two friends, both in California, who had licensed midwives, and both, unfortunately, both had to go to the hospital to have their births due to two different complications. But I thought, I was going to add in here, and maybe legal can chime in, is I thought if you were unlicensed, that there was a disclosure that you may have to make, and I couldn't get my finger on it, and I didn't know that would help my colleague, but that was a requirement. And I thought that was something that I did like about this bill, is that people could continue to practice, but if they do that, there would have to be full disclosure to their patient. But maybe I can lean on legal. It was a pretty big bill, and I read it a while ago. Thanks.
Thank you for that. And that is part of the bill, that there would be a disclosure that would have to form to be filled out so that the client would know exactly whom they were hiring. And that's to protect the client and the midwife.
Tiffany Hoffman, for the record, that disclosure would be for all midwives, not just unlicensed or uncertified midwives.
Any additional questions? I don't see any. I just have a couple, probably more clarification. So nothing in this bill is mandatory, correct? As far as, are you mandating for the certified midwives to now be licensed?
The licensing is optional for those who choose to be held at a higher standard. And by doing that, would have other resources available to them to work in their profession that other unlicensed certified professional midwives would not have in our state.
Thank you. My second question is, because right now, if you are only certified, and I mean, God forbid, things happen along the way, is there a way that we are tracking that?
Tiffany Hoffman, for the record, there is no way to track that, and there is no recourse for families if, like the story that the Assemblywoman shared, there is no recourse for families in that case. And in many cases, it would protect midwives from criminal prosecution because there is a path and a process in place.
Thank you. And my last question is, I just wanted to confirm, so 36 states have regulated midwives, correct? And are we the only one on the western side that are not regulated?
Amanda MacDonald, for the record. Yes, we are the only state on the western side of the country who has no regulation. There are those few on that map that you can see that are either working on it, have a current bill. There's only 3 states in the entire country who aren't doing anything about licensure right now.
Thank you for that. Any additional questions? Sure. Assemblyman O'Neill.
I apologize, and I appreciate allowing the second question. I just have, it's sort of a policy/fiscal question, but with the limited number of midwives that we have here in the state, and since it is optional to join, is the licensing board, I forget exactly, would it be sustainable, or what would the fees have to be to sustain that board for review and to handle the complaints, et cetera?
Danielle Monroe Moreno, for the record, my conversations with DHHS is that it would be sustainable.
Very good then, thank you.
I don't see any additional questions, so we will move for testimony in support of Assembly Bill 386. I do want to remind everyone that we are going to do 30 minutes in support testimony, 30 minutes in opposition testimony, and 30 minutes in neutral testimony. We will have 10 minutes here, 10 minutes in Las Vegas, and 10 minutes on the phone. You do have 2 minutes each. It doesn't mean you have to use the whole entire minutes. If your testimony is close to the person that just went before you, ditto is perfectly acceptable. And with that, is there anyone here in Carson City wishing to testify in support of Assembly Bill 386? Please state and spell your name for the record.
Hi, my name is Andrea Thompson. That's Andrea. Last name Thompson. I'm here in support of this bill 386. I am a dual certified family nurse practitioner and psychiatric nurse practitioner currently practicing in Nevada. I also focus on reproductive psychiatry and probably one of the only ones certified in the state through Postpartum Support International. And so those really sad stories that you hear then get referred to me when the mother's mental health is not well. I'm also a mom of 3 and someone who also chose home birth as an option in Nevada when I moved here several years ago, and also a hospital transfer because I'm a nurse at heart and we have tough stories always, okay? It's really important to me that home birth is accessible here. It's also very important to me that we have safety in mind. In states and communities where home birth is very successful, it's in areas where there's very good transfer options. So very good collaborative care between hospital providers, whether it's an MD or a nurse midwife or nurses, and those who are providing home birth care in this area. And that is something we really lack here. As someone who hospital transferred, it can be very difficult when you've basically been hiding that you've been planning a home birth from an obstetrician. If we had a licensure for these providers in the midwifery community who are providing community home births, these physicians and nurse practitioners would be much more willing to collaborate care for transfer, whether that was during pregnancy or also during labor and delivery. It's really important that we expand access. You know, as a nurse practitioner, I want to see Nevada move forward, and we've got to continue to push things like this in order to move our state forward for Nevadans and not only keep providers here, but get better access to care and also improve outcomes. You know, our maternal mortality rate could certainly use improvement, our infant mortality rate. And so I really hope that you will really keep patient safety in mind, accountability in mind. And if you are thinking to yourself, man, I wish I could go to a physician or a nurse practitioner who wasn't licensed, I think you should think about this particular bill as well of wanting to have a licensed provider.
Thank you for your testimony. Is there anyone else here in Carson City wishing to testify in support? I don't see anyone. Is there anyone in Oh.
Sorry if he gets noisy. My name is Melissa Mayfield, Melissa Mayfield. I'm actually a Washington licensed midwife. I recently relocated to Nevada in November. I'm a 2-time home birth mother as well. This little guy in February here in Nevada. I completed my training and practice in Washington State before we relocated here, and licensed midwives are trained to carry and administer the life-saving medications we've been discussing. We're also rigorously tested on the knowledge and use of them for the licensure process. As practicing providers, we are best suited for lobbying to establish, maintain, or widen our scope of practice to benefit the families we serve. It is my belief through my experiences working within licensure parameters in Washington State and from the large-scale study conducted with the community birth data from there, that licensure, as well as being well integrated into the healthcare system, maximizes the safety of community births. Through mutually collaborative relationships with higher-level providers, we're able to efficiently and responsibly refer for elevated care when the need arises, because we are seen as legitimate practicing providers. This ease of collaboration increases not only the safety of birthing people and their babies, but also lowers the stress relating to obtaining these sometimes necessary pregnancy and postpartum services, thereby increasing satisfaction levels when their course of care becomes more complex. This is important because the emotional well-being of birthing families matters as much as their physical well-being during such a sacred time in their lives. I'm not currently practicing in Nevada, but am proud to be a licensed midwife and would enjoy doing so under the licensure that is being heard today.
Thank you for your testimony. Is there anyone else wishing to testify in support? I don't see anyone. Is there anyone in Las Vegas wishing to testify in support to Assembly Bill 386?
Good evening, Chair.
Good evening. Please state and spell your name for the record. You have 2 minutes.
I'm Aisha Goins, AESHAGOINS. I'm here on behalf of the NAACP and also WIN, with women in the NAACP, and as a mother. We know that Black women experience disproportionately high rates of maternal mortality and morbidity. A new study shows that Black and brown birthing parents and families are dying at a larger number since the 70s. Can you believe that? Certified midwives who are trained to provide culturally appropriate care and to address the unique needs of Black women can help to mitigate these disparities and improve health outcomes. I want to thank Assemblywoman Danielle Monroe-Moreno and also the presenters, because I appreciate the proposed bill and how it recognized that not all midwives have to be licensed, that they may choose. And therefore, it does not require for licensed midwives. This approach strikes a balance between ensuring quality care for women and representing the choices of midwives who may not wish to obtain a license, also while sustaining autonomy for those birthing parents and families. Additionally, the use of the disclosure for all midwives will promote transparency and informed decisions making among birth parents and families. This will help ensure that all parents have access to the information they need to make informed decisions about their care and to midwives who align with their values and preference. In conclusion, I strongly urge you to support this bill that will seek to allow licensure and also the disclosure of all midwives. Thank you for your time.
Thank you for your testimony. Is there anyone else in Las Vegas wishing to testify in support of Assembly Bill 386?
Hi, my name is Cassie Franco. I'm a certified professional midwife practicing here in Las Vegas. I apologize. My name is CASSIE-FRANCO. I'm also a licensed midwife in the state of Arizona. I support AB 386. I think the presenters did an excellent job of showing how it can benefit families here in Nevada. Some of the points that I feel really strongly about are the disclosure. I am also a home birth mom. 2 of my 3 kids were born at home here in Las Vegas. And while I love my midwife, I would have appreciated that disclosure at the time. I feel very strongly about opening up midwifery care to Medicaid. I think we can greatly expand service and access to people who need it. Yeah, I'm in agreement. Thank you.
Thank you for your testimony. Is there anyone else in Las Vegas wishing to testify in support of Assembly Bill 386? I don't see anyone. Broadcast, is there anyone on the line wishing to testify in support?
Callers, if you'd like to testify in support of Assembly Bill 386, please press star 9 now to take your place in the queue.
Can you hear me?
We can. You can please state and spell your name for the record, and you may begin when you're ready.
Thank you. My name is Heather Areshenko. Last name spelled Areshenko. A woman giving birth should be and feel safe. For someone like me, I have a chronic illness, so walking into a hospital facility is not a place that I ever feel safe. I've spent way too much time there as a patient. It's a scary place to be. When I had my daughter, I received care from what I believe was a provider who was inadequately prepared for normal variations of birth, which ultimately led to a cesarean section. The doctor who delivered my daughter was someone I met for the first time when I was in labor. or when I was in labor and delivery at the hospital. And then I was fully dilated with no medication or interventions thus far. I wasn't believed when I showed up and I said I was having my baby that day because he said I wasn't in enough pain to be in labor. But I had already labored at home in a comfortable environment, and pain only began when he came in the room, turned the lights on, made me lay down on my back, and started talking about me rather than to me. My child was breech, but the doctor said since he wasn't trained to deliver a breech baby, even though he had over a decade of experience, that I would be having a cesarean. Midwives are trained for those situations. They're trained to refer to a hospital when the need arises, and they're trained to recognize normal variations of birth and help the woman through that. I ended up with what I feel like was an unnecessary surgical procedure that, according to a recent study, I think from 2019, it increased my risk of severe complications by 50 to 80%, and most certainly impacted my mental and physical health negatively. The vast majority of births are not emergencies, but rather become emergencies due to the cascade of unnecessary interventions that are often from women who are in the hospital and do not have access to a midwife. Our bodies and minds know what to do and how to birth. And when we're allowed to have a physiological birth in a quiet, calm environment with support people that we trust and who have helped educate us, it works. And there's 8 billion people on earth that prove that. I was shocked to learn that in Nevada, midwives were not licensed.
Ma'am,
yeah.
If you can please wrap up your testimony. It's been over 2 minutes.
I'm so sorry.
That's okay.
I support this bill. That's all. Thank you.
Thank you.
Hello, everybody. Elizabeth Merritt for the record. Last name is Marrett. Can everybody hear me okay?
We can. You can start when you're ready.
Thank you so much. So I am in support of Bill 386 for licensure for midwives. I had a home birth myself almost 3 years ago. I was so moved by the safe, high quality care that my certified professional midwife provided me that I'm actually now currently a student midwife myself. I highly believe that every future birthing person in the state of Nevada deserves the safe and beautiful home birth that I was able to experience. My midwife certification helped ensure that I was safe, my baby was safe, and that the professionals that were present were high caliber and aware of any and all possible outcomes. Personally, local midwife certification ensures I receive a higher standard of education of midwifery care so that I can continue to hold space for my future clients in their birth journeys. And then lastly, the licensing would help current providers and my future self to build relationships with other healthcare providers in the community to better serve our clients if collaboration is necessary. So in summary, I'm in support of this bill. Thank you.
Hi, my name is Bron Roberts, ROBERTS, and I am a Reno, Nevada resident in strong support of this bill. In 2021, I birthed with a local CPM and did extensive research before choosing my provider. I chose this model of care for my birth because I felt that the continuity of care was important to me. Unfortunately, I got a Bandl's ring. This is an extremely rare birth complication in which a restricting ring forms in the uterus. The baby becomes trapped by the ring and cannot descend. This is a condition that is extremely rare and cannot be predicted, tested for, and does not have indications until late in labor. The Bandl's ring is associated with infant mortality rates greater than 50% and requires timely C-section births. My midwife and her second were present through my laboring period, charting and monitoring me and my baby. We made the decision to transfer to the hospital, which we had planned for, and my daughter was safely born via C-section. I did not get the home birth experience that I desired, but most importantly, I felt that my midwife was informed in her assessment of my birth and had the appropriate education and training to guide my decision to transfer with informed consent. Although my transfer went well and the staff at Renown Health were as accommodating as possible, I can just imagine what a seamless experience it could be if there was greater integration, trust, and professional collaboration between midwives and other healthcare providers. I am now 37 weeks pregnant and planning a birth with the same midwife. I think my birth experience could have been devastatingly different if I had a different midwife who did not follow the same practices. I did the research to find this incredible midwife, but I wish that everyone in our community could have that same access. Everyone should feel safe in choosing to birth with a midwife with the knowledge that there is transparency, accountability, and the standards in place. Thank you for your time.
Hello, my name is Julia Marie Mays. For the record, that is Julia Marie, last name Mayes. I am testifying in support of AB 386, access to licensed midwives. As a woman, mother of 4, all of who were delivered in Nevada, as well as a member of WIN, the Women of NAACP for our local chapter, we are highly in favor of this bill. All birthing women, regardless of their socioeconomic status, should have the option of safe and healthy care from qualified midwives in Nevada, accomplished through disclosure, accountability, and higher professional standards, especially for the disparities we see in the quality of care women of color receive in both home and hospital births. It is still extremely disheartening to know that Black and brown women are still subjected to unfair treatment and quality of care during some of the most delicate and vulnerable times of their life, welcoming their children into the world. We hope that the committee sees fit to support this as well. Thank you for your time.
For the record, my name is Andrea Cole, Andrea Koell. I live in Friendly, Nevada, and as a birth and labor doula and future birthing person, I support Bill 386. The importance of having safe, healthy options for clients and birthing people cannot be understated, and having options for licensure for our midwives is crucial in facilitating this. Thank you.
Caller with the last 3 digits 364, please press *6 to unmute.
Hello?
Hi, we can hear you. You may begin when you're ready.
All right. Brendan Turner, BrenDenTurner. I do not have any written down, and I'm just going to speak from the heart here, but I think the most logical thing stated about this is that it is allowing for the option of midwives to advance themselves in this community as opposed to hindering people's options. I think that whether somebody decides to give birth in a riverbed or in a hospital bed, people are going to choose to use their own autonomy as a free American however they see fit. And it is our responsibility to support and uphold our community and to make sure that people that choose to give birth at home have options and have access to professional care. You know, we want to uphold a level of excellence here in our state of Nevada. We don't want to, uphold a level of mediocrity, right? So I think that's the most beautiful thing, is that we have everything to gain from this and nothing to lose, in my opinion. We allow people the option for more, and that's all I have to say about that. Thank you.
Good evening. My name is Marina Barrett, and I'm here to emphatically encourage you to support AB 386. I am mostly in support because of the safe options that this bill provides, the provider accountability, and the access to all in our community. You've heard birth stories from others, and I have my own. I just want to share that when you have a birth that goes bad, you don't wish it upon your enemy. And when you have it go good, it fills your heart in a way that you want to share that with everyone in your community. And I think that this bill is a way for our community to have more experiences like that. So I am in support of it.
Good evening, Chair Marzola and members of the committee. Kanani Espinoza, Espinoza, speaking on behalf of Nevada State College this evening. Nevada State College graduated 47% of all bachelor's nurses from NSHE last year. Nevada State College supports safe and accessible healthcare for Nevadans. We thank the bill sponsor for bringing this legislation forward and support the passage of AB 386. Thank you.
Caller with the last three digits 005, you are unmuted and may begin. Caller with the last three digits 005, you're unmuted on our end. Is your phone muted? Caller with the last three digits 942, please press *6 to unmute yourself.
Hi there. My name is Kylie Lester, K-I-L-E-Y, last name Lester, L-E-S-T-E-R. I'm a doctor of physical therapy and a board-certified pelvic floor specialist. The vast majority of my caseload is birth preparation and postpartum rehabilitation. I listen to birth stories every day, and over the years can report that very few patients who utilize midwifery care know that we currently don't even have licensure and are shocked and disappointed at this information. Thorough, informed consent is crucial, and I believe people deserve to know their options and the training of all of their providers. In addition to my professional hearty support of AB 386, personally, I also chose to deliver both of my children at home with the support of two licensed in California midwives who kept me safe and provided exceptional care, and I would absolutely love that so deeply for the rest of our community. Thank you for listening.
Caller with the last three digits 254, please press *6 to unmute yourself.
Good evening, everyone. My name is Kate Weber, Dr. Kate Weber, Kateweber. I'm a certified nurse midwife and proctor for UNLV's new nurse midwifery program. Really excited to say that we received our pre-accreditation today. UNLV is in support of CPM licensure for at least 4 reasons. The first being that the National Association of CPMs supports CPM licensure. It says that licensure is key to making community-based midwifery more widely accessible, more integrated, and more accountable. Number 2, the better midwifery is integrated into the perinatal system, the more flexible the system is, and the more prepared Nevada will be for future shifts toward community birth that may be related to pandemics or other emergencies. Third reason is that a system where midwives are more integrated is a system in which there are structural supports for greater equity in perinatal care. For instance, making Medicaid reimbursement available to CPMs makes their care more accessible for families using Medicaid to cover their care. And number 4, Nevada has a severe and growing shortage of maternity care providers, which you're already aware of. It has one of the lowest numbers of OBGYNs per capita nationally. And resolving maternity care deserts and improving perinatal health outcomes requires an all-hands-on-deck approach that utilizes the expertise of all qualified team members. The western one-third of the country already has licensed CPMs, and you saw the map where Nevada is an island surrounded by other states that have licensed CPMs. Those states are already making progress towards integration, making strides towards maternal-child health outcomes. Nevada can do just as well as them. So that is why UNLV supports 386. Thanks for your time and attention to perinatal health in Nevada.
Chair, there are no more callers in support at this time.
Thank you. We will now move to testimony in opposition to Assembly Bill 386. Is there anyone here in Carson City wishing to testify in opposition? Please remember to state and spell your name for the record. You each have 2 minutes.
Evening. Jeff Soler, JEFFSOHLER. I oppose this bill. I'm a professional firefighter and paramedic here in Northern Nevada for almost 10 years now. I've been to numerous births, near births, labor complications, and a myriad of other medical issues. I'm a father of 4 home birth children and a husband of 1 phenomenal certified professional licensed midwife for over 10 years. 14 years ago, we used a midwife along with her students and assistants. As my wife and I became experienced professionals we are today, we still relied on our midwife and other students and different assistants in our last birth 8 months ago. So here we are, 4 years later, trying to pass essentially the same bill with just 2 out of the over 50 midwives in Nevada pushing this. The support of this bill for the ones it's going to be directly affecting is not here. In my profession, when there's such drastic changes wanting to be made by a mere minority, it's usually due to their own lack of performance or abilities. But I can't speak to their agenda. I only know that none of their colleagues are buying what they're trying to sell. This bill will force many midwives out of work. The remaining midwives will lose the use of their students and assistants. By reducing the number of qualified midwives in Nevada, it will be putting more of a strain on already strained 911 and hospital service that already has barely sustainable growth rate. In rural Nevada, if there is a medical emergency with either the mother or newborn or both, this would restrict students and assistants the ability to perform potentially life-saving interventions while waiting for EMS or a midwife to arrive, in some cases upwards of over an hour. Midwives, their students, and their assistants are trained in CPR and NRP, neonatal resuscitation. The training provides the knowledge to perform resuscitation on a newborn baby. This class is not mandated in most, if any, fire departments and EMS agencies in Nevada. It is a special skill set with different algorithms, techniques, and supplies. Most agencies don't even carry the correct supplies for neonatal resuscitation. This bill would keep that person that is trained, has the knowledge, skills, and abilities to perform such interventions outside the home by law, just because they are a student or assistant. EMS and fire would be used much more often if this bill passes, putting us into a specialized field where we know very little about.
Thank you for your testimony.
My name is Ben Edis, Benediss. Good evening. I'm a Nevada native, born and raised right here in Carson City, and I'm the father to 3 amazing boys. All 3 of my boys were born at home under the care of midwives, and because of this, I've been asked by the opposition of this bill to speak to you today. At first, when I heard that this bill was geared towards allowing the marginalized to have greater access to midwifery care, I could not fully understand why anybody would oppose it. I believe that all pregnant mothers should be under the care of a midwife so long as it's medically viable. However, after discussing this bill with those who are much more learned than myself, I now stand in opposition precisely because this bill would have the reverse effect it aims to accomplish. While in theory, midwifery would be available to those who qualify for it, it would also effectively push out those who do not, those like myself and my wife. When my wife was pregnant with our youngest, we were going through some of the hardest financial times that we've ever had. And at the time, we did not know how we were going to afford the prenatal and birth care of our coming child. That was all until we discovered that someone within our community had donated the money to cover those costs. Community. Community is the true heart behind midwifery. And if this bill passes, it will remove the ability for midwives to work directly with their communities. Let me be clear, I am for the safety of babies and their mothers. But after hearing everything that this bill is trying to accomplish, it sounds as though midwifery would become just another regulated program in which state subsidy would act as a middleman to those like myself who live in rural areas. It would crush small midwifery businesses all over the state of Nevada and alienate the small communities that make this state great. As a man who loves and fights for Nevada, I ask that you join me in that fight and protect our small rural communities. Do not take something our community cherishes and make it another government program. Thank you.
My name is Rafael Arroyo, for the record. Just here as a father. 3 children. The first one tried to have a home. After a 22-hour labor, we did have to transfer to a hospital. He was born via C-section. And then the next 2, we were able to have at home, at home births with a midwife. Our midwife was a traditional midwife. She was not licensed. She had about, 35 years of experience and thousands of births under her belt, most of them in Las Vegas. And I want to say the Assemblywoman Monroe Moreno, I think she's trying to do a good thing here. I've spoken with her personally, and I know her intentions are good with the bill. There's a lot of good things in the bill, giving CPMs access to medicine if they want it, doing birth centers. I think those are good things for the people that want to exercise those options. My niece recently had a baby at the birth center in Las Vegas and had a great experience. But I think that there's a lot of detailed issues in the bill that's hard to translate to, in a presentation like this. There's very precise language, and the midwives and the people in the community that really are reading this stuff and are looking at it are finding, some issues and some concerns, and they've communicated those to me, and that's why I'm in opposition, not because of the intention of the bill. I think there's a lot of good things and a lot of good stats, and I do support birth centers and home births, but I just want to make sure that the legislators understand, what they're actually passing and that they do understand the detailed language. I don't want to have parents or midwives be criminalized because they're unlicensed, and that is something that has happened in other states where licensure begins, and then there's a slippery slope, to basically midwives being eliminated. I think that's the concern. Thank you.
My name is Lenny Sue Tinseth, Tinseth. Good evening, Assemblywoman Marzella and the committee members. I'm a licensed midwife. I'm also a certified professional midwife. I hold a bridge certificate with NARM, our organization, and I am a certified health coach. I've been practicing for 37 years in Northern Nevada. I represent the Great Basin Midwives and the Nevada Midwives Association. This bill is opposed by the 20 midwives in Nevada Midwives Association and supported by only a handful, as we understand it. This bill is poorly written and leads to contradictions concerning licensure requirements, educational routes, regulatory board fulfillment, status of students, requirements for malpractice insurance, to mention just a few. I would like to focus on the regulatory board, which requires, as I understand it, 3 types of medical professionals and 4 licensed midwives. Boards where there are professions regulating another profession are not successful. I am licensed in the state of California and serve families as well. The California Midwifery Law of 1993 established a more medicalized board as proposed in AB 386. It was a dysfunctional board as midwives and the medical representatives were at odds when establishing regulations for midwifery. Licensure did not make a better working relationship between OBs and midwives in the state of California. After licensure was established, an experienced midwife was brought up on charges in California, Allison Osborne versus the state of California. She was exonerated, and the judge's final statement was, OB medical standards and midwifery medical model of care were like apples and oranges. They cannot be compared, they cannot be judged, or regulate each other. California remediated the problem by dismantling the existing board and creating a midwifery board that consists of licensed midwives and citizens. There's a seat for an OB, but it's presently empty. California has no midwifery educational programs. There is only one seat needed to be filled by a licensed professional that practices in the state who works in maternity and/or child services.
Ma'am, can you please wrap up your testimony?
Thank you.
Thank you.
And the management of the industry would be ineffective, and the community will be the party that will suffer. And thank you.
Thank you for your testimony. We will take the both of you, and then we will move to Las Vegas.
Thank you. My name is Brian Abbott. That's Brian Abbott. I'm the father of 4 boys. Our first was born in the hospital, and then the next 3 were all born at home with a midwife here in Nevada. I have a lot of problems with this bill. I don't think I can go over them all in 2 minutes, but to me, the biggest part here is that we've heard a lot about this being an option, only an option. And we've seen in lots of industries where once a regulatory board is established, that board essentially continues to pass more and more regulation and push for registration and things that eventually edge out any competition. And so even though today, as the bill stands, it would be optional, I feel strongly that in a year or 5 years or 10 years, it would no longer be optional. And as Lenny Sue just pointed out to you, often having a board of professionals that don't actually represent the people who they're regulating and are not accountable to the industry they're regulating or to the community in any way results in bad outcomes. And that's the opposite of what we want to achieve. I'd also like to question why the bill requires midwives to seek a single specific type of certification to become licensed when there's multiple different groups within the United States that license midwives or certify midwives. Why are we standardizing on a single one of those? And if this is totally optional and in support of community midwives, why don't we have the ability for I don't know what the right word is, the traditional midwives to become licensed through here? My fear would be that the costs, the associated schooling costs, and the additional cost of licensure is going to squeeze those midwives out, which is going to harm, both the small businesses that they run today and also the access to that care in the communities they serve today. Sorry, I'm just looking at some notes I took. I don't think we need regulation for this at all. I'm over time. Thank you for hearing me.
Thank you for your testimony.
I'm opposed.
I do encourage everyone to turn in your testimony in writing as well, and we will make it part of the record, whether you got to testify or not. You may begin when you're ready.
My name is Tara Abbott. It's Tara Abbott, and I oppose this bill. As a student midwife, I was going through apprenticeship to kind of become a traditional midwife. Because of some injuries that had happened to me, I had to put that away for a little while. But I would love to become a midwife again. I have started picking up going to births. I'm assisting right now. And because of that, I am required to do specific training and be certified in different things and trained in special ways. As Jeff said, that if we call 911 because we get to the birth before the midwife and something happens to the baby and the baby is born in the home alone with the parents, we have the person who's certified sitting outside waiting and not able to come in and help save that baby. So it will limit my abilities with certifications that I do have and can use in my capability. But the biggest thing is it will limit my ability to become a midwife. Because of the cost of schooling. I'm raising 4 boys at home. I homeschool. It's going to really, really limit me in my availability to be able to become a midwife because of the type of training that I will have to go through. I am opposed.
Thank you for your testimony. We will now move to Las Vegas. I see that the 3 of you are ready. You may begin when you're ready.
Hi, my name is Rebecca Wells, REBECCAWELLS. I have been a midwife in Southern Nevada since 2010. There is overwhelming opposition to this bill within the industry of midwives. I am here to represent Nevada Midwives Association and the midwives who have spoken out against this bill and signed the following letter. To whom it may concern. Nevada Midwives Association is an organization of midwives in Nevada that has been in existence since 1984. We are opposed to the licensure bill AB 386 that has been proposed this session. The association behind this bill, the Nevada chapter of the National Association of Certified Professional Midwives, has limited membership and does not represent the industry as a whole. Only 2 practicing Nevada midwives have shown public support for the bill, and they are the authors of this bill. Side note, this was written before today's hearing, and we have heard from a couple of more midwives, but that's how this letter was written. We have been carefully watching the surrounding states as they have adopted licensure for midwives, and in every case, choice is removed from the women giving birth there. Nevada remains a free and legal state for practicing autonomous midwifery, is the last in the Western U.S., and is often a haven for women who travel from other states to have their babies here in Nevada with our midwives. We provide accountability and peer review through our association and have since 1984. Our clients are overwhelmingly happy with our services and are appreciative of the freedom that they have to choose where and with whom to deliver their babies. We believe that freedom in childbirth is a human right and that women must retain autonomy over their bodies during the birth process. Placing midwives under a board not of their peers will remove this autonomy from women and is a major reason we are opposed to this bill. Midwifery and obstetrics are 2 different professions. It is inappropriate to place on the board of one profession someone of another profession. Midwives should be governed by other midwives only. And this is signed by 29 Nevada midwives, 12 of whom are CPMs or certified professional midwives. And I did attach this to the bill so you can see that list. Since I have a little bit more time, I wanted to mention that we do have recourse for families through NMA, and that has functioned. Also, the disclosure form that has been talked about, midwives have no problem providing informed consent. We do that already. However, that disclosure form is being written by a board that has no B on it and does not have any traditional midwives on it, although the traditional midwives would be required by law to have their clients sign that paper. So
Ma'am?
that's part of the problem too.
Ma'am, if you can wrap
Okay.
up your testimony, please.
Thank you.
I appreciate it. Thank you. You may begin when you're ready.
Thank you. Hello, my name is Faith Bosket, Faith Bosket, and I oppose the midwifery bill AB 386. I want to thank everyone who has come out tonight to be heard and our representatives for listening. I'm a Black mother and midwife in rural Nevada. I've had the joy of birthing 7 of my 8 children in the safe, respectful comfort of my home. I chose home birth because I didn't like the way my OB was treating me and ignoring my thoughts and questions. I left the care of this licensed caregiver and hired a midwife. This OB was later charged with harming a Black baby when he arrived at Sunrise Hospital drunk. Home birth families know that licensed doesn't guarantee safety. All of my home births were assisted by trained, experienced midwives. These midwives continue to encourage the next generation of midwives, including myself. I attended the Black Midwives Conference in Alabama in May of last year. Alabama has only 1 new Black midwife. Before licensure, there was 300. Licensure eliminates access to prenatal care for Black mothers. Licensure also eliminates pathways for Black women to become midwives and serve their underserved communities. Black mothers and babies die 5 times the rate of other women. Black women don't need or deserve limited access to midwifery care. There has never been an illegal midwife in Nevada. There has never been a barrier to hiring any type of midwife in Nevada. I was very thankful when this bill died last session, and I hope it fails to damage the future access and freedoms of my 8 Black children and our community. My family and the community thank you for opposing AB 36. I would also like to say, in rural Nevada, midwifery care is the only option for care. Thank you.
Thank you for your testimony. You may begin when you're ready.
Hi, my name is. Oh, sorry. Oh, wait, sorry, Camilla, go ahead. Good evening, Madam Chair and committee members. My name is Camila Santiago, Camila I am a Latina immigrant from Brazil, home birth mother of 3 daughters, and certified professional midwife with a bridge certificate. I'm also a committee member of Nevada Midwives Association and North American Register of Midwife Complaint Review Board member for Nevada. The amended educational requirements in this bill raise many concerns. As a first-generation immigrant that did not come from a financial privileged position, the required MEEC education means to be obligated to attend 2 or 3 years worth of prerequisites because my overseas education is not valid here. MEEC schools are expensive. Some programs can cost near $50,000. Very few provide financial assistance or scholarships. I personally have never qualified for any sort of financial assistance since I set foot in this country. So MEEC education would be an out-of-pocket cost for me and the great majority of midwives in this state. MEEC school credits are no transferable. If I wish to advance my career to pursue nursing or medical school, for example, I would have to start from scratch. The CPM credentialing process is already extensive and not free, not mentioning the cost of books, gas, childcare, continuing education, and 2 years of unpaid apprenticeship at a minimum. CPMs with or without MEEC education take the same exam. The CPM process is a professional pathway that already keeps CPMs proficient and accountable. This requirement is a direct conflict of interest with the authors of the bill, which happens to be the only 2 midwives, along with a new transplant to the state, that have MEEC schooling in Nevada. I am aware of exceptions on a case-by-case basis. However, being obligated to plead to a board to open an exception because a midwife is part of a minority, how is that inclusive to all CPMs? I really wish I could obtain a degree from a MEEC school, don't get me wrong. But this being a requirement is elitist, financially burdensome.
Ma'am, can you please wrap up your testimony? Your time has ended.
Yes. Is elitist, financially burdensome, and completely redundant to CPMs. For the aforementioned reasons, I oppose AB 386. Thank you for the opportunity to speak.
Thank you. We will take 2 more people in Las Vegas, and then we will go to the phones. You may begin when you're ready.
Hi, my name is Tiffany Gonzalez, Tiffanie I am a certified professional midwife practicing in Southern Nevada, and I've been practicing for 10 years. I am opposed to this bill, AB 386. I'm very familiar with the process to become a CPM, as I've personally gone through the process, and I'm also a NARM preceptor. NARM has an outline for each person that chooses to go through that process. The MEEC accreditation in the bill that talks about making that mandatory is going to eliminate pathways for people to become a midwife. I oppose this bill because of that. I oppose also in the bill for the board to be represented as only midwives on that board. There are no other boards that you can have a different profession governing you. I oppose this bill, and I am a CPM here in Southern Nevada.
Thank you for your testimony. You may begin when you're ready.
Hello, my name is Cassia Lopez. I live in rural Southern Nevada, and I am a home birth mother and birth photographer. I'm here to oppose AB 386. There have been a few meetings where concerns of families and many midwives have been able to be heard, but in our opinion, they haven't really been considered. Issues that leave families and midwives in strong opposition because there haven't been any substantial changes towards our wishes. I'm here to oppose this bill for all the reasons stated already, and additionally because it is not the answer to the issues we have around birth services in Nevada. I have had the privilege to witness many midwives serving families as a birth photographer. Most people only get to see the ones they personally hire. I've seen many Nevada midwives and obstetricians serving families over the past 7 years. Every one of them is different in their style of care, but every midwife I've seen in Nevada serves their clients with abundant respect, wisdom, understanding, and skill. I want to emphasize the skill. Not every birth I've photographed was typical. I've seen breech, twin, up to 45-week gestation, and many, many VBACs. Every one of these has allowed me to witness an informed woman in her power, supported by skillful women who they get to choose to be with them. I've also experienced this care with my own 3 births. If we are aiming for greater access to these services, we should consider making changes to current policy in regards to who can bill Medicaid, who can work in birth centers, and expanding the privileges of CNMs, instead of introducing more regulations to currently practicing midwives. Thank you.
Thank you for your testimony. We have to go to the phones now, but I would say please turn in your written testimony and we will make it part of the record. Thank you. BPS, is there anyone on the phone lines wishing to testify in opposition to Assembly Bill 386?
Callers, if you'd like to testify in opposition to Assembly Bill 386, please press star 9 now to take your place in the queue.
Good evening, Madam Chair and everyone. Thank you so much for allowing testimony to be given tonight. My name is Laniqua McLeod. That's LANIQUAMCCLOUD. And as a mother, a future grandmother, and Black and African mother, I completely reject this bill in its entirety with the contradictory language of the bill. And a bigger question is, if we already have the option for midwives who would like to be licensed, can have the option to be licensed, then why are we requiring a regulation to begin with? And I really just want to tell you a quick story, because for the first time I had the option to have full autonomy over my pregnancy, it was with my second child. My first child, I had a very traumatic experience in the hospital, and I had the full responsibility to research and find the midwife that worked for me, and I was able to do that, but it required me to be responsible and take on the ownership of finding the midwife that worked for my family. And if it had not been for the diligence and skills and experience that my midwife had, I would not be here to tell you this story today. I was completely safe with my midwife and the support that she gave me in all aspects. And we've been practically begging the bill sponsor to stop trying to implement more control over birth choices when we all know that freedom of choice is what works. Being licensed as an individual doesn't mean that you're the best or that you're the safe. And the bigger question I have is, why are we not requiring OBs to provide conformed and consent if you want to require midwives to do that for their patients? Why are we not requiring OBs to do the same thing if you want to have a layout of all their education? And so it's just to kind of wrap things up. We all know that simply a mandate can pretty much occur if you just make amendments. We all know that. So my hope is that it is not for this to be pushed so that later it can be mandated for those midwives who do not want to be licensed. And I just want to thank you so much for providing the space for everyone to give their opinions and their opposition. Thank you.
Thank you for your testimony. BPS, is there anyone else on the line?
Caller, with the last 3 digits 644, please press star 6 to unmute yourself.
Hi, my name is Shauna Wagner, SJANAWAGNER. I appreciate you guys hearing me tonight. I have 3 main points that I have concerns with regarding this bill in reading it. So my first one is the cultural sensitivity and racial training for the renewals. As a mother of 7 home birth children, I care more about the continuing education training of my midwife than I do about, meeting critical race theory bullet points. I have never heard in all of my years of there actually being an issue regarding differences in racial and equality and stuff. And so that's one thing that's very concerning, that we're going to focus on that one point for renewal instead of the actual educational requirements for the midwives. My second concern is in listening to this, the gentleman who made the question earlier about is it going to be required or not, and is it explicitly stated in the bill? In reading the bill, I never got the impression that it was a optional licensure. It was kind of written, and I understood it as this is going to be required. So for you to come in and say, okay, this is optional, there is that confusion because some of the individuals who spoke in favor of this bill actually specified with emphasis all midwives, licensure for all. And then my third point is the informed consent stipulation. I understand that, and the midwives that I have experienced, they've all had that. In reading the bill, the third step is that the midwives are required to call 911 until they're relieved by a higher provider, provider of care. To me, that is a concern because, as a mother, yes, I will finish up. Thank you.
Thank you so much.
Yes, ma'am.
Good evening, Madam Chair and Committee. My name is Monica Breitenbach. That's Monica, and my last name is Breitenbach, Breitenbach. I do oppose this bill. My reason for opposing is I would lose autonomy over my body and I lose my freedom in birth. The reason I am stating that is within this bill, because of the way that I have had children, I am a mother of 8, 3 births and 8 early miscarriages at 6 weeks. My second pregnancy was an emergency C-section, and in my most recent pregnancy, a breech presentation. I was delivering a baby at home with a trained midwife who knew what they were doing. I wasn't concerned for my safety. I was not concerned for the safety of my child. The midwife knew what they were doing. The midwives in northern rural Nevada, where I live, have already informed me that if this bill is to pass, they will no longer be able to practice midwifery, and I will be left with no options and no one to hire. It's important to note that these are women-owned small businesses, and we will be taking away from Nevada's economy and the businesses that women are running to support other women. I do oppose this bill as it removes my freedom. Thank you very much for your time.
Thank you for your testimony. Broadcast, is there anyone else on the line?
Caller with the last 3 digits 795, please press *6 to unmute yourself.
Thank you. I couldn't figure out the mute thing. My name is Emily Barney, for the record, EMILYBARNEY. I'm a birth, postpartum, and death doula, end-of-life planner in Reno. I'm the executive director and the co-founder for the Doula Co-op and a member of the Doula Advisory Committee for the Nevada Certification Board. As a doula, reproductive justice advocate, and hopeful mother-to-be, I oppose AB 386 for several reasons. This bill is not an example of equitable maternal health care and should be opposed if women and birthing people will maintain autonomy in their decisions surrounding the birth of their babies, and if midwifery will remain a safe and effective option for families in Nevada. Over 80% of midwives in the Nevada area and all across the state oppose this bill. You've heard from many of them. This includes nearly every type of practicing midwife in the industry: student midwives, midwife assistants, CPMs, traditional and community midwives. You've heard from the families, the birth advocates, and the other people who needed to speak their stories and share their voice. Under the current bill, the terminology and the language will restrict the actions and educational opportunities for midwives, as you've heard, and it will, frankly, it will prevent me from ever having the midwife who I've chosen to attend my birth. She is a traditional midwife, and she will not be able to practice midwifery. Her education will no longer be able to qualify for the provisions under the bill. And so she will have to start midwifery school over again. She is a single mother, and that would be incredibly hard on her and her family to do in order for me to have the birth that I want in the future. So I oppose this bill for the future me, the future me's, and people out there who want to have the midwife that they choose support their birth. And this bill will not allow that to happen. And I oppose it, and I hope you do too. Thank you for your time.
Thank you for your testimony. Broadcast, is there anyone else on the line?
Hello, Chair and members of the committee. My name is Samantha DeAndrea, SAMANTHA, capital ANDREA. I am a mother, a doula in Reno, Nevada, a co-founder of the Doula Co-op, a 501c3 nonprofit in Nevada. And I graduated midwifery school last year, and I hope to continue on to be a community midwife in Nevada. This bill may be intended to improve safety and outcomes for underserved communities in Nevada. And yet, with the current language, it will restrict families and autonomy and their choices. It will restrict access to midwifery care, especially for rural communities. It will restrict accessibility to becoming a midwife for students, which will reduce the amount of midwives able to serve families. This bill will serve to eliminate the essence of the midwifery model of care by medicine and the state, which are separate entities and should be kept separate. I oppose this bill, and I hope you do too. Thank you so much for your time.
Thank you for your testimony. Broadcast, is there anyone else on the line?
Chair, that was the last caller in opposition at this time.
Thank you. We will move to testimony in neutral. Is there anyone here in Carson City wishing to testify in neutral? I don't see anyone. Is there anyone in Las Vegas wishing to testify in neutral to Assembly Bill 386? I don't see anyone. Broadcast, is there anyone on the line wishing to testify in neutral?
Callers, if you'd like to testify in neutral for Assembly Bill 386, please press star 9 now to take your place in the queue. Caller with the last 3 digits, 225, please press star 6 to unmute yourself.
Hi, my hand was raised during the opposition of the bill. I don't know why it didn't reflect that. I still want to give my opposition for this bill.
Ma'am, opposition has closed. We did 10 minutes in Carson, 10 minutes in Las Vegas, and 10 minutes on the phone. But you are more than welcome to submit your testimony in writing. We are in neutral testimony at this time.
I understand that, but you asked if somebody was still on the line, and I was still on the line, and it wasn't acknowledged. So you had a chance for one more person. It just, for whatever technical reasons, I wasn't allowed to speak.
And I apologize for that, but we did take 10 minutes on the phone. Again, 10 minutes in Las Vegas and 10 minutes in Carson City. So please submit your testimony in writing. Broadcast, is there anyone else on the phone that wishes to testify in neutral to Assembly Bill 386?
Yes, my name is Leslie Quinn, and in regards to AB 386, I'm a little confused because I can see both sides of the coin, but the confusion is all the legislature that's out there trying to give women their body autonomy, and yet this does not give their women their body autonomy.
Ma'am, are you testifying in a neutral position? And if so, can you please state and spell your name for the record?
My name is Leslie, Leslie. Last name is Quinn, Quinn. And what I was saying is that I can see both sides of this bill, AB 386. I can see the side that is being promoted, and I can see the side in opposition. So what I'm trying to say is that I, as a neutral person, I'm confused as to why this bill is here, or, why someone would support it versus why somebody would not. And I can understand both sides of the coin. The coin is, with all the legislation out there that wants to give women their body autonomy, this bill's not doing that. And that's the confusing part. So that's why I'm standing like that. And I also was somebody who was in line when you did ask for more callers. So please oppose AB 386.
Thank you, and thank you for your testimony. We will move your testimony to the opposition. Broadcast, is there anyone else on the line wishing to testify in the neutral position to Assembly Bill 386?
Chair, we have no more callers in neutral at this time.
Thank you. Assemblywoman, would you like to give some final remarks?
Thank you, Madam Chair and Committee, for hearing this bill and hearing both the support and the opposition. You can hear the passion from both sides of this bill. This bill does not require anyone to be licensed, which means it would not criminalize anyone either, unless someone were to say that they were licensed once we have a licensure and they are not, and that's how they hold themselves out. It does require a disclosure, so to protect the midwife and the birthing parents, the birthing family, the birthing person, so that they know who they are hiring. I cannot testify what has happened in other states with their legislation and what went on in the drafting of the legislation or the consequences that happen in other states. What I can say, and I can't predict what will happen here, but what I can say is what my intentions are with this bill from day one was to make it optional. And believe me, after everything that I went through and that my family went through and that the midwives that presented with me went through last legislative session, I truly wanted to go back on my word, but I believe that you are nothing in this building if you are not a legislator of your word. And I said that this would be optional, and that is the intent of this bill, to create a licensure for those midwives that want to have regulation and have access. And it was stated in the opposition about the MICA training. In the amendment, as stated during my presentation, that had been removed from the bill. So with that, I'll say thank you again for hearing this, and thank you for staying late on a Monday night in a deadline week.
Thank you, Assemblywoman. I just want to remind everyone again, and I encourage everyone that did not get to testify, whether in support or opposition, I don't believe we had any neutral, to please submit your testimony in writing so that it can be part of the record. And I too thank you for staying with us so late. And with that, I will close the hearing on Assembly Bill 386. I will now open up for public comment. Please address your remarks to issues that fall within the jurisdiction of this committee. If you direct your remarks to issues over which this committee has no oversight, I will ask you to redirect your remarks. Also, I would like to remind everyone that public comment is not a time to rehear any bills. Public comment is limited to 2 minutes per person. Please remember to state and spell your name for the record. And with that, is there anyone here in Carson City wishing to give public comment? I don't see anyone. Is there anyone in Las Vegas wishing to give public comment? I don't see anyone. Broadcast, is there anyone on the line wishing to provide public comment?
Callers, if you'd like to provide public comment, please press star 9 now to take your place in the queue.
Hello, my name is Celeste Parks, CELES I'm a registered nurse in Las Vegas, and I'm also currently studying for my doctorate in women's health, along with becoming a certified nurse midwife. I just want to make my public comment stating that.
Ma'am,
Yes.
you can talk in general. You cannot talk about any of the bills that we heard today. Those bills have closed.
Okay. Sure, absolutely. I would just state that midwifery is very special. And midwifery care involves trusting relationship between the provider and the pregnant mother who share decision making. I think it's very important to keep regulations or quote unquote mandates on midwives to make sure that is separate from them.
Ma'am?
So I truly believe, yes.
Like I said, Assembly Bill 386, the hearing has closed. And so do you have another public comment?
I just really believe that this was very unfair. There was quite a few of us that did have a lot to say to this.
And I understand, and I suggest that you submit your testimony in writing.
And I understand that. Okay, and I understand.
Thank you. Broadcast, is there anyone else on the line wishing to give public comment?
Hello, my name is Lorena Cardenas. That's LORENACARDENAS. I'm in Assembly District 5, and I just wanted to say for the record that there is no such thing as a birthing person, only a birthing mother, as only women have a uterus and can give birth. So I would appreciate if we stop this whole open-minded nonsense and we refer to women as birthing women, not people, it's exclusive to us women. Thank you.
Caller with the last three digits, 124, please press *6 to unmute yourself.
Hey, good evening. God bless. I just want to say, like the rest of us, we've been waiting in line, and we've been obviously not afforded the time to.
Sir, I do understand. I do understand your concern. Assembly Bill 386 has closed. I did give opposition 30 minutes. If you want to submit your testimony in writing, I will make sure that it gets to the committee manager. We are in public comment. Broadcast, is there anyone on the line for public comment?
Hi, my name is Jessica Ansel, JESSICA-ANCELL, and I'd like to have it on the record that I was also trying to call in and give
Ma'am, and I understand that you might have been on hold, but we gave opposition and support and neutral at the same time, and so you are more than welcome to submit your testimony in opposition to the committee secretary. This is not the time to rehear a bill. The bill has closed. This is public comment. Thank you.
Yes, my name is Leslie Quinn, and I'd like to read something to everybody. The First Amendment of the U.S. Constitution states, Congress shall make no law respecting an establishment of religion or prohibiting the free exercise thereof, or abridging the freedom of speech or of the press, or the right of the people peaceably to assemble and to petition the government for a redress of grievance. Recently, that didn't happen with a chairperson. We had our Vice President of the United States, Kamala Harris, go and complain about legislators that were taken off the floor because they had a bullhorn in session, and they should not have done that. She said it was undemocratic. Now, on April 6th, Assemblyman Gray was disrespectfully silenced by Chairwoman Miller during a gun control hearing for SB 355. Assemblyman Gray was simply doing his job, representing thousands of his constituents by being their voice, their First Amendment voice, their freedom of speech voice, also their right to petition the government voice. But these freedoms were unfairly and unconstitutionally silenced by Assemblywoman Miller. I'm just asking all of you legislators to please be constitutional in your representation, whether you're a chairperson or whether you're just a legislator. There are thousands of people that you represent, and you're there to represent them, not special interest groups, or not yourself, or not those who donated to your campaign. Please represent we the people, and please take the time to listen to people and fix the freaking phone systems because they're not working correctly. Thank you. Have a good evening.
Thank you so much for your testimony. Broadcast, is there anyone else on the line wishing to give public comment?
Hello, my name is Amy Carter, AMYCARDER, and I would just like to hear from the committee members a promise they will read all of the written testimony.
Thank you for your testimony. Broadcast, is there anyone else on the line wishing to give public comment?
Chair, there are no more callers wishing to give public comment at this time.
Thank you. Committee members, are there any comments before we adjourn? I don't see any. This concludes our meeting for today. Our next meeting will be Wednesday, April 12th at 1:30. Thank you.